Okay. I'm going to call a special meeting of the Board of Aldermen to order on Tuesday, December 21st, 2021 at 7:01 p.m. in the Aldermanic Chamber, as well as via Zoom teleconference. Prayer will be offered by Deputy Clerk Allison Waite, and Alderman Harriet Gathright will lead us in the pledge to the flag.
Almighty God, we have the high honor and the serious duty to manage the affairs of our beloved city. Fill us, O God, with the spirit of unity and understanding, which enables us to face our multiple problems with a serene mind, with justice and charity for all, so that any and all decisions made by us will always be for the betterment and greater happiness of all our fellow citizens. So help us God. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Amen to God.
I'm not going to tolerate outbursts from the audience. You will have to leave. We will have everyone removed from the audience if I don't get cooperation. Thank you. Also, I'm sorry. Let's start the meeting by taking a roll call attendance. When each member states their presence, please indicate if participating via Zoom why you are not meeting in person and whether there is anyone in the room with you during this meeting, which is required under the Right to Know law.
Alderman
Would the
O'Brien?
clerk please call the roll?
Alderman O'Brien's present.
Alderman Cleet.
Here.
Alderwoman Kelly. Alderman Dowd.
Present.
Alderman Karen.
Here.
Alderman Clemens.
Thank you. I am here participating via Zoom. Reason being is I have work matters, and there's no one in the room with me.
Alderman Lopez.
Here.
Alderman Tenza.
Present.
Alderwoman Liu.
I'm here alone, and I'm attending remotely due to exposure to COVID.
Alderman Jettie.
Here.
Alderman Schmidt.
I'm present.
Alderman Laws. Alderman Cleaver.
Present via Zoom because of mobility and health issues. My daughter.
Alderman Harriet Gathright.
Present.
And Alderman Wilshire.
I'm here.
All right, you have 10 in attendance and 3 via Zoom.
We have a quorum. Also with us this evening is Mayor Donchis and Corporation Counsel Steve Bolton. As is customary, I'm going to turn the meeting over to the Chairman of the Planning and Economic Development Committee, Alderman Tenza.
Thank you, Madam President. The first item on the agenda tonight is a public hearing for 021-073, amending the inclusionary zoning supplemental use regulations. I believe that Mr. Cummings, Mr. Sullivan are here. We're going to make a brief presentation, and then we'll hear testimony in favor and against this ordinance.
Thank you, Mr. Chairman. For the record, Tim Cummings. I'm the Director of Economic Development for the city. I'm going to just quickly pull up my screen here. Joining me this evening in the chamber, we have Matt Sullivan, who is our Planning Director, as you may know, and then also participating remotely, we have the consultant who's been working with us on this project, Kyle. Kyle, can you say hello?
Hello.
Thank you. So Kyle is going to be available to answer any questions that may arise. So if I may, Mr. Chair?
Please.
Thank you. So just a couple slides to help provide an overview and an orientation to the topic we're discussing this evening. And of course, we are here to ask for your favorable recommendation on ordinance 02173. So RKG, our planning consultant, performed a housing market analysis for us, identifying challenges and needs. That was done over the last couple of years, and with that, they identified the idea of improving our existing inclusionary zoning bylaw that we have currently on the books, just to update it to the current market needs. So they made a recommendation that we improve our inclusionary zoning policy, but to do that, we would first need to study the financial climate and the policies that would go with it. So further study was done this past spring and into the summer. And this fall, we convened some working sessions with this body here, with the Board of Aldermen, which ultimately developed the language that got crafted and put into O2173. So some of the findings that we found out in the housing study was, Nashua is growing, the population is getting more diverse, the income disparity is increasing. 1 and 2 bedroom homes are driving the growth. Downtown should be a focus of housing and housing development to create a mixed use environment. Predominantly, the housing stock is single family. And we know that there is increasing demand and increasing rents, and housing costs are going up. The housing study came up with some high-level identified findings: the growth, affordability, minimize displacement, try to improve housing in the downtown, and making sure we leverage the existing resources was outlined in the study. And then specifically a strategy that I referenced just a second ago was the idea of updating our inclusionary zoning. And we would need to study various elements, which we did. What size of development do we want to apply the IZ to? Where should the IZ be applied in the city? How many units should be set aside for the inclusionary zoning? These types of questions we studied over the last 6 months or so. We've had a conversation on, and ultimately it was what ended up in the ordinance before you this evening is what we discussed. So to do that type of study, we had to undertake the financial feasibility process, which, we did some data collection to understand what the market conditions are, developed some scenarios through in a pro forma, then looked at what type of strategies would be necessary to try to get the policy goals that we've articulated, and then memorialize that all in a report. So that was the work that we did to develop the inclusionary ordinance recommendations to date. And of course, what we needed to do is balance the public and private interests. We wanted to make sure that we created a policy that was revenue neutral, and the biggest way to do that is to provide density bonuses for the inclusionary housing. Ultimately, it led to this chart here, this table, which is the main thrust of the ordinance that's before you, and it's what we discussed previously. I will note that we're taking a phased approach, which if this ordinance is to be adopted, January to June, development with units less than 49, this would not take effect or be applicable, so it's only for a larger scale type of development up until July 1st. We felt that was important to make sure we provided some stability into the marketplace, and that was a recommendation made by this body when we met with you earlier in the fall. And so essentially what this table outlines is, units that are less than 10 citywide would not have an inclusionary component. And again, when I say inclusionary, make sure so folks understand what I'm referencing. When we're talking about setting aside a unit, depending on where you are, the percentage changes, but a unit or a couple units, depending on the size of the development, to be dedicated as quote-unquote affordable housing. Affordable housing, as we've defined it, is 80% of AMI. AMI stands for area median income, and that is what we're hoping to try to do to get a mixed income approach to development in an effort to achieve more affordability into the marketplace. So again, units that are that are under 50, you would then start to see an inclusionary component. we're saying that 10 units, or 10%, I should say, rather, would be set aside as quote-unquote affordable at 80% AMI. And then we are trying to actually have the affordable units constructed as much as possible. We are not trying to have people pay us a payment in lieu of fee at this time, under this scenario, when you're talking about ownership. But we are suggesting it through a special exemption process at the rental units, starting at 10 units or more. And there's a value associated of $37,000 per unit at rental, and if it's an ownership model, it'd be $100,000 per unit or per lot. And the density bonus is pretty much 1-for-1. For every one affordable housing unit you provide, you'd get an additional one housing unit to be constructed on top of what you were planning on. Unless you're doing it in the downtown, then for every one affordable housing unit you'd be providing, you'd be given the ability to construct 2.5 units. So that's just a quick outline of the chart in front of you, and what is actually captured and memorialized in the ordinance before you that we ask for your favorable recommendation on. Thank you.
Thank you, Director Cummings. So we will be also talking about this at the Planning and Economic Development Committee meeting following this Board of Aldermen meeting, so we'll hold any questions from the board until then. So right now, I'm going to open up the public hearing, where, as is the usual practice, we're going to take testimony in favor of the ordinance, then testimony in opposition, again, a chance for testimony in favor, and finally, a chance for testimony in opposition to the ordinance. So I will start with the people in the chamber here. Is there anyone here who would like to offer testimony in favor of O2173? Mr. Keating, why don't you come on up?
My name is Bob Keating from 5 Coburn Woods, member of Unitarian Universalist Church and Granite State Organizing Project. I want to speak in favor of this ordinance. I think it was a very thorough process. Appreciate the Community Development Office and Economic Development. There was lots of opportunities for, obviously, the aldermen and the public at large for this. We think this is a step forward. Clearly, the ordinance as written currently was not providing the incentive for developers to build, and I think with this being a required process, obviously that's going to make a significant difference. We did lobby for a period of time and advocate for rental housing at the 50 units to move to 60%, but we think at this point we'll just wholeheartedly support this, and hoping as this gets passed and as we move forward that we'll be able to change some of the income targets on it. But just appreciate this. It's not going to end all and be all for affordable housing, but it is a step forward, and just appreciate all the work to make this happen. So, thank you.
Thank you. Anyone else in the chamber who would like to offer testimony in favor of O2173? Please just come up to the microphone.
Good evening, and thank you for the opportunity to speak. My name is Christy Basada. I live at 12 Nutmeg Drive in Nashua. I am also clergy serving Main Street United Methodist Church in Nashua, and I'm representing the Greater Nashua Interfaith Housing Justice Group, as well as the Nashua chapter of the Granite State Organizing Project. I am here to throw my full weight behind the passage of this amendment to inclusionary zoning. As a former frontline worker and program manager serving families who were struggling with housing instability in Nashua, I have personally witnessed how the soaring housing costs in the city have contributed to the cost burdening of our families and have also contributed to homelessness. This legislation in its current form will ensure the creation of more housing for people who live and work in our community. And what this bill actually does in real dollar figures is to support housing that is affordable to singles making $56,000 to $80,000 a year, as well as families of four earning in the bracket of $70,000 to $110,000 a year. These households are contributing to our community. They deserve to be able to grow and thrive in our community while supporting the local economy, and they are already cost burdened by the soaring cost of housing. I come before you also to say that this should not be the last step in creating affordable housing in Nashua, though it is an extremely important step. And I urge you to continue to consider and approve programs that support housing for other workforce housing projects. I congratulate you for bringing mandatory inclusionary zoning forward, and I thank you for all the work that has come from urban programs and planning and economic development. And I urge you to continue to do this challenging good work of creating housing for the people who live, work, and play in this community. Thank you again for the opportunity to comment.
Thank you. Anyone else in the chamber who would like to offer testimony in favor of O 2173?
Yes, Lori Ortolano, 41 Berkeley Street. I'm glad to see this coming forward and a first step to add, affordable housing to the Nashua stock. I have a couple questions about the plan, and I'm hoping I can get some answers. The inclusionary zoning policy matrix that was put up here on the screen is different than the one that's attached to the board agenda that I just pulled off a line. And I believe that one from less than 10 and 10 to 49 was excluded. And now you've added 10 to 49 is part of the program that requires affordable housing. I don't know if I saw that differently. Was there a point where the data was different?
There are two matrices presented within the policy. The policy that was posted online actually should include both, and I believe it does include both. The first matrix is related to the policy that will exist from January 1st of 2022 to June 30th of 2022.
Okay.
The second matrix that Director Cummings showed this evening is a policy that will exist, believed to be in perpetuity, but will obviously be updated from July 1st, 2022 until a subsequent update happens. And so there are two independent matrices that are intended to be a ramp up of the policy and its implementation.
Okay, perfect. So I'm a little bit concerned about the group that falls in the 10 to 49 when you look at bonusing, that they can get a density bonus. That's not a very high number of housing units. I went to a presentation down in South Nashua where there's those townhomes going in, 11 blocks, 44 houses. They would fall in this thing. They would end up with 4 that would be part of the inclusionary, have to be affordable housing. They'd get a bonus, which would allow them to put another building up. But I don't know that there's the space to actually do that and make the bonus work. So I think the bonus might work best for numbers above that. But that's just a thought, and that doesn't mean I don't support this, because I do. It's something you can check out. But I was wondering if you have a mechanism in place on how you're going to monitor this and look at the success of the program. It would be really nice when the board adopts these things, that once a year you come back, the planning board or somebody, with a table, a chart that shows how many affordable housing units were created, what we did within these neighborhoods and the benefits we saw, so we can actually have some tracking. I think that would be really helpful, and that's not part of the ordinance, but I think it would be very helpful. And I'm also wondering in section C, under terms, location, and size of affordable
30 seconds.
units, how did we pick 99 years as the time frame for the affordability? Why did we go with such a long term?
So the initial intent was to provide a restriction in perpetuity, but obviously within the state of New Hampshire, we cannot do that. And so 99 years was viewed as the best effort in that regard. I will say the existing ordinance has a range of term within it. It goes from 10 up to 30 years in how long that term actually lasts.
Okay.
Our intent here is to protect as long a term affordability as possible, and so that's why we chose that 99-year period.
Thank you.
Thank you, Ms. Ortolano. Anyone else in the chamber in favor of O 2173? Okay, seeing none, I'll call online. Is there anyone online who is in favor of, who would like to testify in favor of O 2173?
Right here.
Yep. Rabbi Spira Savet, please go ahead.
Thank you. My name is Jonathan Spiris-Savet. I am at 39 Coburn Avenue in Ward 1, and I'm also the rabbi of Temple Beth Abraham in Nashua, and member with Reverend Basada of the Greater Nashua Interfaith Housing Justice Group, and also represented Ward 1 on the steering committee for the Citizen Steering Committee for the Master Plan. I'm really very appreciative of all the work that our city departments have been doing, and you, the Board of Aldermen, and many, many fellow citizens on this. I've spoken about this at your last meeting about it, so I don't want to repeat much that has been said or that I've said or others have said. But I support myself and on behalf of the Housing Justice Group this ordinance for pragmatic reasons and for moral reasons. The master plan, in terms of pragmatic reasons, sets a goal of adding several thousand new units of housing in our city for all segments of the market, for renters and for owners, and reducing substantially the number of people who pay more than they can reasonably afford for housing. And inclusionary zoning is one part of the answer to all of these goals, and it's a very, very good model for all hands on deck, the city and private builders and nonprofits like NeighborWorks and all parts and areas of our city. And that's going to help us do the following things as well that we'll need to do in these areas. And it's part of that in and of itself is part of, for me, the moral case, meeting the needs of people, as Reverend Basada said, who work and learn and play and age here and are part of our life in Nashua and want to live here. We want all to be part of the same community. Affordable housing as a moral issue is good for all of us in the community, especially when it is everywhere. And this kind of process and what we can learn by doing this together will help us create a kind of community that's not in segments but all together. And also help us ultimately by living closer together to surface the kind of wisdom to help us develop new approaches to affordable housing beyond this one and address other kinds of future issues that affect us all. So I hope very, very much that the Aldermen will support this new ordinance.
Thank you. Anyone else online who would like to testify in favor of O 2173? There's someone with their hand raised that's just identified as iPhone. So please state your name and address for the record.
Hi, my name is Tanya Nisley. I'm at 83 Major Drive. I am in Ward 7 right now. I say that I am in favor of the inclusionary zoning law. I go on the record that being a resident that lives in public housing right now, I do have to say that I'm very disappointed at the 80% AMI income base that we are going to help, considering that Nashua is a very low income city and we definitely need more support for 60% AMI and under. But with that said, I am again in support of the inclusionary zoning law. Thank you so much.
Thank you. Representative Mangiapudi.
Thank you. I'm Representative Lata Mangiapudi from Ward 8, 20 Salmon Brook Drive, and I'm really encouraged with the approach that's taken. The housing is a critical need, and on a regular basis, I get calls from students and people moving in. You know, the biggest concern they have is the housing not available for all range, affordable, workforce, low income, seniors. And so this is the first step, and the word inclusionary zoning speaks volumes. And I hope the action follows with that we are all included and together we can raise. And I hope that Alderman, Board of Aldermen will positively support this, and we critical need for housing. You know, one of my colleagues talked about how home is where the jobs go to sleep. So if you're having workforce shortage, we have to provide the home so the workers can go home and live and play and celebrate life together. So this is a very important step. It's not end all and be all, but it's a step in the right direction. Collectively, this will make a big impact for our community. And thank you, and I'm in, big support of this effort, and hopefully we'll see this happen in my lifetime.
Thank you. Anyone else online who would like to speak in favor of this? Okay, seeing none, we'll turn our attention now to anyone in the chamber here who would like to offer testimony in opposition to O21-073. All right, seeing none, we'll go online. Is there anyone online who would like to offer testimony in opposition to O21-073? Seeing none, we'll go back to testimony in favor of O21-073. Anybody new who would like to offer testimony in favor? No one in the chamber? Anybody online? Seeing none, now is the opportunity to offer testimony in opposition to 021-073. Seeing no one in the chamber, I'll offer it one more time for folks online. Okay, for the record, there was no one online who wanted to speak in opposition of it. So at this time, Madam President, I will close the public hearing on ordinance O21-073 at 7:27 p.m. And turn the meeting back over to you, Madam President.
Thank you, Alderman Tenza.
Madam President, if I may, just for a little clerk housekeeping, through the chair, if Mr. Cummings can give the presentation copy to our administrative assistant so we can have it for the record.
Yes.
Thank you.
Okay. New business ordinances.
First reading of O21-083, relative to requiring face coverings through January 31, 2022.
Alderman O'Brien.
Thank you, Madam President. I would like to make the motion to suspend the rules and allow for a second reading of O21-083.
Motion is for a second reading of ordinance 21-083. Discussion on the motion? Seeing none, would the clerk please call the roll?
Alderman O'Brien.
Yes.
Alderman Clee.
Yes.
Alderman Dowd.
Yes.
Alderman Karen.
Yes.
Alderman Clemmons.
Yes.
Alderman Lopez.
Yes.
Alderman Tenza.
Yes.
Alderwoman Lou.
Yes.
Alderman Jettie.
Yes.
Alderman Schmidt.
Yes.
Alderman Cleaver.
Yes.
Alderman Harriet Gathright.
Yes.
And Alderman Wilshire.
Yes,
You have 13 yeas and 0 nays.
and that motion carries.
Second reading of O21-083, relative to requiring face coverings through January 31, 2022.
Alderman O'Brien.
Thank you, Madam President. I would like to make a motion for final passage of O21-083 by roll call, and if I may speak to my motion, please.
Alderman O'Brien.
Thank you, Madam President. I wanted to give this a positive as what we should recommendation for the motion. However, though, I am going to listen to the debate on this particular motion. I'm not 100% sure, but I made a positive motion to discuss it, and I'll leave it at that, and I'll listen to the debate. Thank you, Madam President.
Thank you. Discussion on the motion. Alderman Dowd.
Yes, I'm still not sure if I'm going to support this. I have a lot of questions, and quite frankly, I was hoping that we wouldn't take any final action on this until next Tuesday's Board of Aldermen meeting. I have talked to a number of establishments. First of all, I fully support our Board of Health, and I know that, that we should be doing all we can to support the Board of Health. However, when we passed this the last time, we were in the midst of the pandemic, and we had no other alternatives. We had no usable vaccine. We weren't set up for testing, and masks were one of the things that could do a great positive thing for negating the spread. Now we're in a position where we have the vaccines, and if you're fully vaccinated, the chances of you having anything severe from the variants that are currently out there is much less. So I understand that we're in a position where most of the inputs I got on this were do not pass it. And the people that don't want it in place are already saying that they won't pay any attention to the ordinance anyway. And the people that are for it are probably already wearing masks and will continue to wear masks. So I'm not sure what passing this ordinance will do for trying to get the assistance that I think the Board of Health is looking for. I would prefer that we offer more places for vaccination and more testing. That seems to be the president's position at this point. And, I hope that we could get input from the Board of Health as to what they think will be the positive impact of this and why they want to do it.
I'd like to invite them to come up if you have questions for them.
I have no problem, yeah.
Director Bagley, if you'd like to join us.
And if I could just continue for a second, the businesses I've talked to are almost universally against the mask mandate for a number of reasons. One, even during the last mask mandate, every time that they had somebody that didn't want a mask, it caused a confrontation. I think with what's going on in the world right now, I'm thinking the confrontations would turn into a fight and be a major issue, which could end up requiring police action. The places that I've talked to said if they're going to be the ones that have to enforce this, they're going to have to hire people, and they're having problems hiring people already to stand at the door and try and enforce the mask mandate. I don't know who we would get that wants to stand there and have a fight with these people over masks. So I'm concerned about what the Board of Health has for their idea how this is going to be enforced, because without that, I can't support it. So I have other questions, but I'm going to send them to Director Bagley if we don't pass this tonight. And we'll send them to the Board of Health.
Director Bagley, would you like to introduce the folks with you this evening?
Yes, good evening. Bobby Bagley, Director of the Division of Public Health and Community Services. And this evening, we have our Chair of the Board of Health, along with two of our board members, Dr. Chuck Capetta and Dr. Stephanie Wolf-Rosenblum is on Zoom. We also have our Chief Public Health Nurse, we have our epidemiologist, and our Public Health Network Services strategist is here. Jane, there's a seat there. And yes, we would like to, Alderman Dow, talk a little bit about why this is important at this particular time. I am going to have our chair start us off, and then if the Board of Aldermen will allow, we'll all do a presentation on why this is important at this particular time to answer some of the questions that you might have with regards to the importance of this at this particular time right now.
Good evening, everyone. Please interrupt me if I start mumbling.
Could you just identify yourself for the transcription?
Yep. My name is Tony Storrs, 17 Cameron Drive, and I am your Board of Health Chairperson. I would like to thank President Wilshire and the Board of Aldermen for calling this special meeting on face coverings. And I would also like to recognize Mayor Donches, Attorney Bolton, and the rest of the administrative team. We appreciate what you've done. First, let me say that I respect everyone's point of view, and we're here to educate everyone on the current state of COVID. The The Board of Health's role is to advise you on what we believe is within our power to minimize the spread and the impact of this dreadful disease. You will hear from the hardworking and dedicated doctors of your Board of Health and the equally hardworking team at the Public Health Department. I don't want to steal my colleagues' thunder, but just set the table for their expertise. You're going to hear about Delta, now responsible for about 27% of new infections, and Omicron, now at 73%. It has become the dominant variant in the United States and continues to expand exponentially. You will hear about infection rates, hospitalizations, increase in positivity tests, hospital beds, or lack thereof, respirators, shortages of hospital staff, upswings in cases per day, community transmission, number of new cases per day, and unfortunately, even deaths. Changing daily are these stats, and a little bit of something for everyone, I'm afraid. Our chief concern is the spike from Thanksgiving holidays and what we and others believe will be a surge added to the current holiday season. After listening to all this and making your head spin, what we'd like the board and the public to remember is this. We have a four-pronged defensive strategy to slow down the spread of COVID. If I may, I would like to use my college football coach's Castle analogy. We have one, vaccines and boosters, representing the Castle's army, thinking throwing hot water and shooting arrows from the ramparts. Social distancing. Castles are built away from other castles and other buildings, high up on hills for a reason. Hand washing, think moats. Masks. Castles are built with thick walls for protection, keeping the enemy out. Yes, I admit this is a simplistic view. Remember, it was for football players. But an analogy that makes it easy to remember why we ask to use masks and other protocols. We truly believe that if we can use these defensive strategies along with educating the public, we have a fighting chance of slowing down the spread and minimizing the impact of COVID. We also want the public to know that we were listening to them during the discussions, and Attorney Bolton has written into the ordinance a time limit. We hope to work together as a team to ensure the safety of the Nashua community. And I'd like to take this moment on the side just to wish everybody a joyous holiday season and best of luck with New Year's resolutions. Thank you. Chuck?
Thank you, Dr. Storrs. At this time, what I'd like to be able to do is to provide a situational update. I am going to share my screen because what this allows is for the Board of Aldermen to see our current situation in our state right now. And, this is really important because as Dr. Storrs mentioned, what you can see from here is where our state is with regards to the infection. So right now, as of today, New Hampshire announced 561 new cases, and that's an average of over 1,054 cases per day, and that's for the most recent 7-day period. This is a 17% decrease compared to the previous 7 days. What I would like to is bring your attention to here, where you can see this spike up with regards to where we are right now. And this is after around the holiday season. You can see how these numbers started to go up as we would see a trending occur with Thanksgiving, with travel, with families getting together, friends getting together. But then you can also see that we're now starting to trend down. And this is, again, we're post the holiday season from Thanksgiving, so we would expect to see a trending down of cases. What we're looking to do is to put this extra layer of protection, the mask mandate, in place because we're going down and we don't want to see those numbers spike back up. From this data that's here, what you can see is right now we're looking at the number of total cases since the pandemic started for the state of New Hampshire, over 187,000, with 7,971 active cases. You'll also see our vaccination rate, one of the metrics and one of the measures that we have in place to help with the stop of this infection. 57.7% fully vaccinated, or 62% that have received at least their first dose. This vaccination rate is still too low for us to be able to have the impact that we want to on the substantial spread that we're seeing in our state right now. And I'm going to show you some Nashua numbers as well, because our numbers in Nashua are higher than what we see at the state rate. Our percent positivity rate is at 12.1%, and that's the 7-day positivity rate, with an average of about over 9,000 tests that are done daily. We've seen this testing numbers go up and down anywhere from 10,000 to 8,000. We need to see those numbers increase as well. A lot of what we're also seeing here is also an underrepresentation of what is truly, what we're truly seeing in our state, because everyone doesn't go to get tested. If folks are asymptomatic, they may not go to get tested either, but they can still spread the infection. We currently, and this is one of the most serious measures that we're looking at, our hospitalization rate is at 437 individuals in the hospital. People that are in the hospital now, they're sicker, they're also younger, and it's going across the age groups, it's going across all demographics. There is no, with this virus, it doesn't care who you are, where you work, and what age you are. We've also had over 1,800 deaths in our state, and our numbers in the state are averaging anywhere from 6 to 8 deaths per day. Now, when we look at our Nashua numbers, I'm just gonna click on, hover right over here, and hopefully the screen comes up there. What you can see, the new case rate per 100,000 for Nashua is at 1198. That's a high number. We're looking for that number to be under 100, and we haven't been there in almost a year. Our 7-day test positivity rate is at 14.9%. Again, a high number. We like to see that under 5. We haven't seen that in a while either. Our new cases over the last 14 days, over 1,000 cases, and for the last 14 days, sorry, and then for the new cases or active cases, 562. So we're looking at a substantial amount of spread that's in our community. And this is right now on the downward trend. Because we've seen what happens, with COVID and with us and our social behaviors, we tend to go down. The next holiday comes, we go back up. But we are already extremely high right now. This is a 25% increase just between Thanksgiving and where we are right now as of December, what do I have on here? As of December 2nd, 25% increase. We're trending down, we'd like to stay down. The request for the temporary mask covering over the next 4 weeks is to help us stay down, keep these numbers down. We've heard from our hospitals the impact that this virus is having on them, with individuals now needing more acute care. ICU beds are full. The capacity at the hospital is strained, and the impact of an increase, another spike up, is going to be detrimental to our hospitals. And you're going to hear more information from our clinicians on this as well. So our goal is really to have an impact over this next 4 weeks and keeping these numbers down. It's unfortunate that in New Hampshire, we had the first announcement of a pediatric death. This is something that we have been trying to prevent since this pandemic began. We've seen numbers of kids in other states that have been infected, where there have been kids that have lost, and it's been documented now that we've lost our first one. One child death is too many. And if putting a simple covering over our mouths will help prevent the continuation of transmission in our communities, that's what our aim is. And at this time, I'd like to turn it over to Dr. Capetta, who will give more science and from a medical perspective on this.
From a vaccine?
He's asking you to.
Yes, thank you. Sorry, just caught out all of a sudden. Hello, my name is Chuck Capetta. My address is 2300 Southwood Drive. I have some prepared to speak, talk I'm going to bring up. Good evening, Mayor Donches, President Wilshire, Aldermen, and Alderwomen. Thank you for taking the time to convene this emergency meeting around the short-term reestablishment of the mask mandate, especially during this busy holiday season. I've been a full-time pediatrician at Dartmouth for the last 31 years and a proud member of the Nashua Board of Health for 7 and physician of record for the Nashua school system for 28. I'm here to fully support and recommend without hesitation or reservation the proposed mask mandate. I'm not here to debate the science or the real facts around the serious pandemic we've all been in for the past 22 months. For me, there's no debate. As a physician and a scientist who took a lifelong professional oath to protect, defend, educate, and support all who I serve each day, COVID is real, COVID makes you sick, and COVID can lead to death anytime, anywhere, and even in fully immunized healthy kids and adults. My position, however, on the Board of Health is a unique one, as I represent a population often without a voice and a seat at the grown-up table. Nothing matters more to me than the lifelong health and well-being of the pediatric age group that now too is under siege from this silent executioner. This virus is an equal opportunistic killer that doesn't care about what street you live on, how much money you make, how you voted in the last election, and what age you are. These statements are fact, not opinion, and are not up for debate in the medical community in which I live and serve and breathe. The COVID vaccine works, there is no doubt. And it's an amazing blessing that we can now offer it to the youngest amongst us, and that there still remains those less than 5, for now, who are still vulnerable, still at risk, and still need to be protected. Mask wearing in public places is one such proven method of protection. You should all have in front of you the indisputable medical statistics presented by my wonderful colleague, Dr. Stephanie Wolf-Rosenblum, who's online, and hear from her next, from last week's Board of Health meeting, upon which our recommendations were made. Since then, you've just seen the scary statistics from Director Bagley and her amazing dedicated team of professionals on how our local cases continue to rise, hospitalizations are up, and our infectivity rate is through the roof. I'm only here to reiterate the indisputable fact that our hospitals, intensive care units from Berlin to Nashua, Keene to the seacoast are overflowing with people on ventilators, if you can find them. People in the hallways waiting to be seen, as all of our local ERs and urgent care facilities struggle with this unseen vector. And we had 2 deaths in Nashua last week from this disease. This is our reality. And in the pediatric world, as we just learned, 1 death is 1 too many. Why is the National Guard and an emergency response team being called into the Granite State to support our medical nursing colleagues if we're not in a crisis? With the arrival of the Omicron variant, we're faced with even more unknown and more anxiety about what may happen or may not happen. It's only a matter of time that this new enemy will take over the Delta variant, if it hasn't already, as the predominant strain in our hospitals, nursing homes, schools, places of worship, places of business, and our homes. As Dr. Storrs had mentioned,
CDC cares, ban cigarettes.
The pillars of defense against this ruthless and unforgiving virus remains the same. Social distancing, hand washing, vaccination, and wearing of masks to prevent droplet infections and the spread to everyone else. You and all the Board of Health members have heard from all of our constituents, or many of them, via email and in person over the last few weeks. And we'll get it. I thought we were a public forum, so I apologize. We'll hear more later. I'm not here to challenge the right or freedom of personal choice around the wearing of masks. This is not on the table, as I truly respect everyone who speaks their mind and shares their thoughts. My physical presence here tonight only shows that I too cherish and value this access to freedom of speech and choice with every ounce of my being. I'm not here to defend the politics of healthcare that somehow seems to have permeated into so much of the discussion around what we now do in our personal and professional lives and the decisions each of us make. What I am here to say is the Board of Health is not political. We have no agenda, ego, or aspirations for fame or glory. We're just here to serve as an advisory group to the mayor and the Board of Alderpersons by 3 dedicated health professionals with over 100 years of serving the Nashua and greater Nashua community. Dr. Storrs is older than I. So that's where most of this comes from.
Thanks, Frank.
From babies to grandmas and everyone in between, on all things related to public health matters. All we care about is how to keep the citizens of Greater Nashua, our friends and families and loved ones safe and well, and as we continue this, so they can have this amazing freedom to do what they want and be who they want to be. There are no winners or losers here tonight. We're all in this together to defeat this microbic nemesis. By protecting the forgotten, the immunocompromised, the youngest and the oldest, we all win in the defense of our collective community health. Wearing of a simple mask for the next month or so is not, in my opinion, too much to ask. My final point is when asked why I have continued to wear a mask outside the office since March of 2020, when this all began, I calmly respond, I wear my mask out of respect for those around me. Even as a fully vaccinated person with a booster on board, I don't know where your immune system is at the time we meet or interact or quietly pass each other in the aisles at Lowe's or Market Basket. I don't even know what my own body's doing at any given time or place in terms of creating antibodies against all we face. But for me, if I can protect those around me by this small gesture, then I've done my bit in the trenches where I live to minimize my chances of passing this silent and deadly adversary on to someone else. The reestablishment of this short-term initiative is in strong support of one extra tool in our toolbox, especially with the holidays and the cold winter months ahead, that we can continue to use to help battle this virus. Nothing more, nothing less. And thank you for letting me talk tonight.
I could follow up.
Alderman Dowd?
Yeah, so my question is, we all know that wearing a mask helps tremendously. One thing we don't know, I don't think at this point, is do we need a better mask for the new variant? Do we need an N95 or a KN95? I'm hearing a lot of that in the press. I'll leave that up to you. The other question I have is, do you think if we pass this ordinance that you're going to get a significantly greater amount of people wearing masks? The ones that are opposed to it say they won't wear them. And the businesses I've talked to won't enforce it. So it's going to cause all kinds of confrontation. I just would like to get your opinion on whether you think this is going to be significant.
What do you find by significant? I mean, I think the reality is, we know, despite the naysayers, that masks do help. And so it's all about personal choice, personal freedom, as I mentioned here. And we all know you guys live it every day. So I think if we can protect one or two in our own individual bubble that we've all created for each other, then that's a step in the right direction. You know, we're not going to move mountains. We in pediatrics take tiny steps, tiny amounts every day, and every little success is a success. So we're not asking for the mountain. We're just asking for the little tip of the iceberg. And this, you know, I hear what you're saying. I respect what you're saying, but I also concur. You know, if we sit truly as a medical advisory group to you guys and women, that this is the right thing at the right time in the face of the numbers that are insurmountable and really scary. I've never been scared in my professional career. I'm scared for kids. I don't know what they're doing. I don't know what's going to happen to them, under 5 in particular, and us adults, the grown-ups in the room, need to step up and show, as an example, we're trying to protect their future by wearing these masks.
The other question I have is do you think that if we passed a major health emergency in Nashua and had signs that said that masks are strongly recommended when you go in versus a mandate, that there'd be a difference? Yeah, she calls the shots.
I'm sorry, Director Bagley.
Yes, Alderman Dowd, we do believe that a mandate will help. We know that there are some people that are going to, as it was mentioned, put on a mask without having a mandate in place. And we know that there are going to be others that will put on their mask because the mandate is in place. And we also know that there are going to be those who are just not going to do it. Our goal is to increase the number of mask wearers so that we can reduce the amount of virus that is transmitted in the community. We need to keep those numbers down. So if more people are putting on a mask, it reduces the amount of virus that's in the community. You asked whether or not a different type of mask has to be used. This face covering with the double layers on it or the surgical mask is all that's needed. And again, it's to stop the respiratory droplets from going from me to someone else that's near me or in the space that I might be in. So that covering will help reduce the spread of those respiratory droplets in the environment. And if more people are doing it, it does reduce the amount of virus that's transmitted. And that's what we want to do. We want to get more people with the mask on.
Dr. Storrs, did you want to weigh in on that?
Yes. One of the questions I believe you asked was, we don't know about whether these masks will be effective against Omicron or any other variant that comes down the road. When we do know, we'll go to something different. I mean, we can't guess the future. One of the things we can do is we can look at the past and we can look and see what happens when we use masks to help protect the public in critical zones where you're inside with a lot of people outside your bubble that you don't know. And we can watch those numbers go down. And so that's what we're using. We're looking at those past events and moving them forward this way. The other thing I'd like to just comment on, and it's because, like Dr. Chuck said, it's the way we're built, it's the way we do business in our mind when we help people. We look at prevention. And as we all age, and we have to have things replace body parts, they're never as good usually as the original. So I would rather prevent disease than repair disease. And so if we can prevent people from getting exposed to COVID, and we haven't even talked about long haulers, people who are going to be in the medical system fighting issues, whether it's hearing loss, respiratory, clotting problems, heart issues, they're going to be in that system because they caught the disease. And yes, maybe it would have happened anyway, I don't know. But if we can do just a little bit to protect, that's what we should be doing. We as a community have an obligation to protect the other people in that community. We shouldn't, I don't know when in our history we got to a point where we've said, my rights are more important than the collective rights or health of our community. And that's a sorry thing, in my opinion. I think we all should just voluntarily wear them. I would be happy if everybody said, you know what, you don't have to mandate. I know this is something that I should do. In here, I know it's right. And I'm gonna do it to protect you. Until we're out of this thing. We've gotta get out of this thing. Otherwise, we're gonna be going through these cycles all the time, especially up in New England, because what do we do in the wintertime? We go inside. You know, the reports from Africa were great about Omicron, but guess what? It's summer there. They haven't gone inside. If you look at Omicron in England, they're having tremendous problems. Now, we're hoping with most viruses, when they mutate, they dummy down. So what happens is the viruses know that if they kill out all the hosts, they can't survive. They have to jump species. So the idea is the more successful ones are contagious, but less virulent. Right? And we're hoping that that's
the world completely stopped turning.
Excuse me, ma'am.
Can you?
You're speaking out of turn. If you speak again, I'll have to remove you.
I'm all set, thank you.
Thank you.
I hope that answers the questions.
Yes.
I see Dr. Rosenblum has her hand up. Would you like to weigh in on that, Dr. Rosenblum?
Yes, thank you so very much, President Wilshire, Alderman, Mayor Donchis, and my esteemed colleagues in the Board of Health and the Public Health Department. You have before you some written remarks in support of implementing the mask mandate in Nashua. And what I'd like to do is build on the remarks that I gave last week and also address some of your questions. We have heard from experts that a COVID-19 viral blizzard is about to hit the United States. And as you have heard, our hospitals are already overwhelmed. There was a question previously that talked about people who said they won't wear masks and businesses that are concerned about enforcement. I'm concerned about those things, but hiring people to assist people with enforcement by providing them with masks and providing them with education is something that's doable. What's not doable is quickly building more ICU beds and staffing those beds. You saw the statistics from Director Bagley. What we know is that people that get hospitalized with COVID-19 spend a week or two in the ICU. So it's not just the number, but it's the length of stay. And what is going to happen when one of us is, God forbid, in an accident or has a heart attack or a stroke or other infections, complications of cancer treatment? How are we going to get treated? I am a trained critical care specialist. And as such, I have spoken to people who said, Doc, I will never XYZ, until they were facing death. And I have stared into the face, the pleading eyes of people who are dying. I have stood on the other side of the bed when my grandchild was near death, and I was pleading with healthcare providers to use everything in their power to save his life, which blessedly they were able to do. But we must bend this curve. Yes, we have vaccines, but as Director Bagley pointed out, those numbers are very, very low. The vaccines have been available for almost a year. And the Pfizer vaccine has been fully endorsed, not just emergency use, for months now. Even if today, every single person on this call, every single person in our community got vaccinated, the immunity takes weeks to build up. It won't help us through the next month. COVID-19 has already killed 1 in 415 Americans and 1 in 100 people over the age of 65. It's the third leading cause of death in the United States. And while much has been made about the fact that underlying medical conditions predispose to severe illness, hospitalization, and death, it's worth noting that things like high blood pressure, being overweight, and having anxiety disorders are risk factors for those things from COVID-19. Dr. Chuck talked about the pediatric risks. This is, at this point, about bending the curve of hospitalizations. So you've heard about the other ways that we can bend the curve, and those things are important. Hand washing is important, especially now we also have flu season upon us because we're indoors. But it's a well-established fact that COVID-19 is predominantly spread through respiratory particles that can hang in the air and cross distances. So while hand washing is important and social distancing is important, then these measures are not enough, especially during the winter months. Most indoor spaces don't have the level of air exchange or antiviral measures that would be needed. Now, publicly available data show that unvaccinated persons face a 10 times greater risk of testing positive, and they may not know it, and a 20 times greater risk of dying from COVID-19 than fully vaccinated people who have also received a booster. And most of those people are dying in the hospital. And as far as the effectiveness of masks, yes, there are masks that are more and more effective, especially for healthcare workers that are constantly exposed on the front lines, all of whom need our help. We have, and I've provided you in writing, a study from the Proceedings of the National Academy of Science that conducted a mega review of all the available data, because people will quote different studies about masks, but the only way in science that we have black and white answers is when you conduct what's called a randomized controlled study. So you take people who get the protection and people who don't, and you put them all at risk. In the middle of a pandemic, You can't do that. That's not ethical. And when we are in a position of substantial community transmission, which all of New Hampshire is, that's the data that can help us to know if we are able to bend this curve and if we are able to reduce our hospitalizations, if only during our concern with the peak that will occur after the holidays, as has been said. Many have questioned why the Board of Aldermen should impose a mask mandate rather than let people make their own decisions. And to help answer this question, we should consider the published science of decision-making. People make good decisions when they have good information and a good amount of information. But that's not what we have right now. There's presently information overload, and sorry to say, a pandemic of misinformation. Intelligent people can make decisions harmful to themselves and others when they're anchored in certain perspectives due to their prior experiences or to the experiences of those around them. Our hospitals, our healthcare workers, our families, our neighbors, our clergy, they all need our help. So I urge you to go forward and enact this time-limited mask mandate ordinance as quickly as possible, because to do nothing right now puts each and every one of us at risk that when we need help, neither the necessary staff nor the equipment will be there. Do it for our healthcare heroes and for the medical and economic health of our community. And finally, if the ordinance is not implemented before Christmas holiday, I urge everyone to take the spread of the Delta and Omicron variants seriously and to take active steps to keep yourselves, your families, and those important to you safe, unless everybody you are celebrating with is fully vaccinated and has received a booster. Please consider using a rapid COVID home test before joining indoor gatherings with others that are not in your household, and please use a mask when you're not actively eating or drinking. These steps will not offer 100% protection, but they'll go a long way towards keeping us all safe. I wish you all a Merry Christmas, a Happy New Year, and I pray that we will be able to gather together again at this time next year in good health and without masks. And I thank you so very much. I'm available to answer questions.
Does anyone have any questions for Dr. Rosenblum? Alderwoman Lou. Do you have a question for Dr. Rosenblum?
She's muted.
You're on mute, Alderwoman Lou.
I didn't have questions for the doctor.
Okay.
I had my hand up before, so I'll step aside.
Dr. Storrs?
We have some other of the team here. Kim, would you like to present, please?
Sure.
Thank you.
Kim Bernard, 21 Lewis Street. Good evening. Thank you to the Board of Aldermen for holding this important meeting. My name is Kim Bernard. I serve as the Chief Public Health Nurse and the Manager of the Community Health Department at the Division of Public Health and Community Services. I've been a nurse for close to 30 years. Since January 2020, our nurses and staff members have been involved in all aspects of the COVID response, following evidence-based scientific research, educating and guiding the citizens of Nashua and the greater Nashua region. Our service over these 2 years includes disease investigation and contact tracing, testing, vaccination, guidance for the community, including but not limited to the general public, schools, businesses, childcares, homeless shelters, rooming houses, city departments, long-term care facilities, and other healthcare partners. Our team of public health nurses provide care based upon scientific medical research. We are committed to serving our whole community, a community that we love, while protecting the health of the most vulnerable as a priority. You have heard the data on numbers of cases, hospitalizations, and deaths. These are mothers, fathers,
brothers, sisters, wives, husbands, actual people from our community, and we owe it to them to do everything we can to prevent more severe illness and death. A fellow public health nurse said it best at the last meeting, stating, "The integrity of a community can be measured by how well we protect our most vulnerable members." As public health professionals, we educate individuals to make informed decisions. We give support and guidance. Some individuals cannot get vaccinated due to factors such as age. Some may be severely immunocompromised. Some may not have proper access to care. As we have seen through the research and our own experience, masking can help protect this population from COVID-19. I say all of this to help our community and the Board of Aldermen understand why we support
There's no
masking
audio.
and the mask mandate.
I just got a text too.
Yeah.
They can't hear anything that's happening here on Zoom.
Jeff?
We can't hear you.
Audio and video has been lost.
Audio's gone.
We understand.
They can't hear us say that.
Jeff, would you
Can we get
please
the people
mute?
back?
We will not comply.
We can
We
hear you. Just
We
bear
will
with
not.
us.
Bear with us.
They can't hear you though.
Yeah, they can. I've got my ear in. Jeff?
No audio.
We understand that.
Jeff?
I am trying.
Okay.
I don't know what happened. What? All right,
All right, mask mandate failed.
everybody, can you hear what's going on in the chamber? Because I can.
No.
No.
And no video either. No, I can see the video though. I hope it failed.
Nothing can be heard.
I can hear you. I can hear you.
If you are muted, then unmute.
Jeff, I can hear you. Both in
Okay,
the
everyone vote
chamber
no.
and on the video.
Okay, we'll resume.
Would you like me just to continue where I left
Yes.
off? Okay. I say all of this to help our community and the Board of Aldermen understand why we support masking and the mask mandate. It is a simple, evidence-based mitigation strategy we can do to protect ourselves and others. As leaders of this community, when we look back in 10 years at how we handled this pandemic, will we honestly be able to say we did everything we could to reduce transmission, prevent death, and promote health? I hope so. Thank you.
Director Bagley?
We do have Jane Goodman, who has some final words to wrap up, and then we'll take questions. We have our epidemiologist, Lindsay Boyd, who started with us Monday, who's also here, that can help explain some of the data if needed. Jane?
Thank you, Director Bagley, and thank you to the Board of Aldermen and Mayor Donches for allowing us to be here tonight to talk about the mask mandate. I don't have prepared remarks as my colleagues do. I really came in support of their extremely eloquent and well-researched testimony tonight. As a public health professional and a public health strategist with the division, I've worked in public health for over 20 years, and we always think of prevention, prevention, prevention. And we have the tools for prevention. There's no reason that we should not throw every tool we have to the prevention of, quite frankly, a preventable illness. So it sounds redundant. But I'm very concerned as I mill around Nashua. If we can get even 20% more, 30% more people in those grocery stores wearing masks, I would feel so much more comfortable for my community, because we would be preventing that transmission that Director Bagley described. As a community, we need to take care of one another. And I hope, as my colleague Kim Bernard said, we continue to do so. And that we look back on this time and we say we did everything we could in order to prevent our friends, our neighbors, our family, and our children who, I still send to school every day, really worried about their future and really worried about not only their future, their teachers, the staff, and everyone else. So I hope that you will see the wisdom in this temporary mask ordinance and help us protect one another because we're in this together.
Dr. Storrs?
I just have a closing story to tell you. I just happened to be opportunistic this week. I was at the office, and I'll call her Casey, a patient that I've known before she was even born. Chuck's right, I've been around a long time. Casey is a young woman who works in the ICU, and so I stopped in and said hi to her and see what was going on. And she's a pretty smart girl. Her parents and Casey have said that I had an influence on her to go into medicine. And she's a nurse, and she's an ICU nurse. And I asked her how things were going, and she said, "Not well, I'm quitting. I'm going to a different part of the hospital. I can't take it anymore. We're working a tremendous amount of hours because we're short-staffed. People are taking early retirement. On one hand, we were the heroes, and now we're on an island by ourselves." And okay, that's Casey's problem until you're the person that goes in the hospital and needs Casey. Now, she's going to stay a nurse, but she's picking something that brings her back to reality. And this is the problem that we haven't even talked about, what's going on in our hospitals. I had word last week that patients were taken out of hospitals in New Hampshire and brought to another state because there wasn't enough room. It's critical. I think that's critical. You can say, yeah, they're overstaffed or overworked, but when patients can't even go to their own community hospital, you're in critical mode now. We need to stem the tide. You talked about enforcement, that's a tough one. I agree, we're not enforcers, we're just giving you our opinions. I think personal responsibility, we all should be responsible, that's the best enforcement. Do I believe in having the police come and making somebody put a mask on, staple it to their face? No. But we've got to do something to help stem the tide. And I hope this is one of the things, like we were talking about, Kim was talking about part of the arsenal, some of the tools that we have. I just plead for you to give us a chance. The next 4 weeks are going to be critical, and hopefully we can get to a point where those numbers go down. You saw what the numbers are. You heard what Bobby said, where the numbers should be. We got to get them down. Okay. Thank you very much for your time. I appreciate that. Questions?
Anyone have questions? Alderman Lopez.
I'm wondering if any of the Board of Health members have insight into any changes in the amount of demand or capacity for ICUs in terms of how healthcare providers may have had to stretch numbers, or how, like, I'm aware that Governor Sununu passed legislation increasing the capacity that a hospital could serve. So what does it look like for the healthcare provider who is working in the ICU now versus how it may have looked 2 years ago?
Well, we had, sorry.
Director Bagley.
I'm sorry, President Wilshire. Well, we had an update from our hospitals yesterday, and from their report out right now, their ICU beds are full. They've actually had to open up secondary units that they're using as ICU beds. In comparison to 2 years ago, we were not at this space. And if you can remember, 2 years ago, we set up the alternative care site with the thought that if the hospitals got to the point of being at surge level, they would use that as a facility to help support what we thought may have needed to occur in the hospitals. All of the hospitals right now across the state are trying to do an in-surge response, meaning that as their numbers go up, they're trying to redirect some of their rooms to take care of these clients that have these higher acute needs. It's gotten to the point right now where we have to have outside help come in. So FEMA is coming in, the National Guard is coming in, there's additional dollars being spent in areas to support expanding internal capacity to be able to meet the need that we have right now. This solution that we're looking for, again, is to reduce the amount of spread in the community so that those numbers go down. The more people get infected, the more hospitalizations can occur because of what we're seeing with the Delta variant and now with the rising numbers of those that are impacted by Omicron. So we know that the more infection that's out there, the higher the probability that somebody's gonna end up in the hospital because this disease right now, people are sicker and their sickness is to the point where they have to be hospitalized. They also shared with us the fact that on some other units, they have to close elective surgeries now because now all the resources have to go to taking care of these more acute patients, which includes the number of increasing COVID patients as well. So we're in a place where whatever we can do to stop the spread of community exposure, we do that so we can decrease the number of individuals going into our hospitals. And this is statewide.
Dr. Storrs?
Just a comment, Dr. Stephanie just texted me and said she can unmute in case anybody wants to ask her questions.
And I believe that was done intentionally because people were speaking out of turn.
Okay, as long as you tell her that she can hear.
Okay. Alderman Lopez.
I just had a follow-up question. With regards to the patients needing acute care, I spent most of last year working with patients that were in the ER, that were undergoing emergency evaluation, that were clinically determined to be a danger to themselves or others and in need of significant stabilizing care. At that time, there was nowhere near the capacity of people or of beds for the people that were in need. And it was often the case that people would spend days and occasionally weeks in the hallway in the emergency room. Has this increase in usage of ICU and this activation of secondary wards made any of that better?
No. They're still talking about border beds in the hospitals. We're still having individuals, in the hallways. They can't get some patients that need to be out fast enough. It's just a situation that we need to see our way out of. And again, with the passing of this temporary mask mandate, we're hoping to slow this curve. We have to slow the curve. Right now, they're in a really tough situation. It cannot get any worse. We've seen how the numbers go down right after the holidays, and so we're getting ready to get into the gatherings again. Those numbers are going to go right back up.
Alderman O'Brien.
Thank you, Madam President. I'll throw this out there to our esteemed Board of Health Board. You come in here, I believe what you're telling us and everything is true. I believe the science. And as some of you know, I come from the fire department and I understand, my doctor would tell me not to eat the bag of potato chips, but I do like potato chips, But the thing is, and I understand the fire marshal would tell me not to play with matches. But the thing is, I got to think about the business community at large too. If we do vote for this in this board, I don't think we can rely on the police department. They got tons of stuff that they got to do. And so it's got to be some hostess, all probably 110 pounds of her. And I think you've seen some of the, aggressiveness, or let's tone that back. We've seen some of how people feel about this, So, we're throwing it on them, to enforce this. I believe in the science. I got a 2-year-old granddaughter. My grandchildren who are of school age are vaccinated, but 2 years old, not yet. So I'm very concerned, and the wife and I take the precautions. But how can we as a board feel comfortable in telling that hostess that she's going to have to man the castle wall, to, enforce the mask mandate. Then also too, let's talk about some of our finer pub and type of environments where somebody, a restaurant, well, somebody will come in from the street wearing a mask, but then remove the mask and sit in a crowded table atmosphere. It seems, counterintuitive to, what we're trying to do here. So if you could just answer those to make me feel a little bit more comfortable and to help this board understand, what your ask, I understand, is based on science, not arguing that. But we have to think the bigger global picture with this. So I'll leave it at that.
Dr. Storrs?
Alderman O'Brien, good question. It really is. I mean, we've talked about this as a group, and believe me, it's above our pay grade when it comes to enforcement. I don't have an answer for you for that, and I respect the police department. I don't expect them, I mean, they're overwhelmed with just what they're doing. And to go running here and running there for mass, it can't be there. The only thing that I can come up with that makes sense to me is that masks are required. And I see that in some establishments, the masks are required inside. It isn't a perfect world. We talked about masks are not always perfect. And if you are gonna go out, I have an infectious disease doc says, I'm not eating out until this thing is gone. Okay? And that's maybe on that side of the railroad track, and we wanna be in the middle of the railroad track. So there are gonna be environments where there's gonna be a compromise. You're gonna take that mask off, there's gonna be particulate matter going around. If there's a singer on stage, that's gonna go farther, faster than somebody's across the table from you. But that's a risk that, that's a calculated risk that you're willing to take. And I can't guarantee you if you wear a mask and you go into a bar or an establishment that you won't get COVID. But that's a risk that you can make on your own. You make that decision to do that. If I go to one of the grocery stores, right, should I be taking that same risk that there might be other people there who are not wearing a mask? Especially in many of our supermarkets that are amazing. We have open food everywhere. I mean, my hair curls when I see dogs in the supermarket, but that's the public health person in me. But if we had something that the city says that, they're required to wear the mask, and if they don't, I don't know how to help you there. I'm sorry, I don't have that answer. My kids would be flabbergasted to hear that Dad didn't have an answer to something. I can't even fake it.
Good try, though. Thank you.
Alderman O'Brien, are there any aldermen online with their hands up?
Yes, Alderman Clemens.
Alderman Clemens, then Alderman Tenza. Oh, and then Alderman Clee.
Can he, we can.
Hi, can you hear me?
Yes.
Okay, thank you. My question on this is more on the enforcement as well. Can somebody articulate to me is this the same penalty that we had in the previous mask ordinance?
Enforcement's outside of my purview. It's your job to come up with that.
Is Corporation Counsel available to answer that, or is somebody available to answer that question?
Attorney Bolton is here. Attorney Bolton?
There is an existing provision in the codification of ordinances that says when no other penalty is provided, a violation is punishable by a maximum fine of $1,000. So that would apply here.
Okay, thank you.
Alderman Tenza?
Thank you. And I think and Attorney Bolton will correct me if I'm wrong, I'm sure, but as I read the ordinance as drafted, as to the questions of enforcement, it doesn't say anything here that the businesses are required to enforce the law. I think the individual who's making the choice to go into the business, certainly the business has a right, if they want to enforce a mask mandate, to ask them to put a mask on, they can do that now. But if someone was to go into a restaurant not wearing a face covering and it wouldn't, I don't think they should feel that they need to fight with the people. I mean, obviously they can take whatever measures they believe are necessary to remove that person from their establishment. They're a private business, they can do that. But I don't see that the business would be liable for anything other than not posting the mask requirement signs. And I know that economic development was very good last time in educating businesses and making sure people have what they need as far as supplies and things like that. So I don't, and the other thing I worry about is, not doing something like this because we're afraid of the few people who are gonna cause a ruckus in the community, right? That's their goal, is to draw attention to themselves and to their issues and draw a ruckus. And I think we should kind of think more globally about everybody who's in the community coming and going. I know my thinking on this issue has changed from our original debate that we had. Back then I thought, well, wearing a mask is, maybe a little bit about personal liberty, and I think back then likened it to wearing a seatbelt. My thinking has changed on this. Now I really think it's, more comparable to, the issue of drunk driving, because no one has the ability to go out and drive under the influence of drugs or alcohol. When these laws are debated in Concord, no one is up there saying, I have an absolute right to get drafted and drunk and drive drunk, because it puts yourself at risk, but it puts other people at risk as well. It would be great, I think some of the doctors talked about this, it would be great if everyone said, look, I'm gonna look out for my fellow neighbor, I'm gonna wear a mask, even if it's just to make other people feel more comfortable. Unfortunately, we see that there's not everybody in the community ascribes to that same way of thinking. So I do think even if it's till the end of January, important to put this in place now. As Ms. Rosebloom said before, it's not gonna help all of our family gatherings that we're gonna have over the next week. But I hope people take her advice. I know my family would be taking her advice and testing beforehand, just to make sure that we're not inadvertently affecting the rest of our family and loved ones. So, thank you.
Alderman Clee, and then Alderman Jettie.
Thank you, President Wilshire. I really took a long time to have to think about this, and after hearing all the numbers and so on, it became a no-brainer for me. It was something that I was going to support. And one of the things that I know that my colleagues that are up in the State House is that we're very familiar with the New Hampshire Constitution, specifically the Bill of Rights, Article 3. Society, its organization and purposes. And it talks about society. It says when men enter into a state of society, they surrender up their natural rights to the society in order to ensure the protection of others. And that's what we're doing here, is we're trying to protect others. It's not just for us. I have been double vaxxed. I've had my booster. It doesn't mean that I can't get it. We all know that I can. But the higher percentage of people that are getting it and ending up in the hospital are those that are unvaxxed. The ones that are having more critical care needs are those that are unvaxxed. I have spoken to both heads of the hospitals, and I know that our ICU beds are overflowing. Not that long ago, I spoke to one that we had 8 patients that had been a couple of days sitting in the ER. And during that time, that was 8 patients sitting there. That day, they were going to able to free up 18 beds. By the end of the day, there were no more beds available in the inn. That's scary. We received emails ad nauseum from, and I don't mean that in negative terms, for and against. I respect everybody that's for it. I respect everybody that's against it. The ones that hit me were ones that spoke about patients being taken care of, not in the ED, but in the waiting room. 3 days. 3 days sitting in a waiting room. And if we can do anything to slow one of those people from not having to be there, I think we should take every single effort that we can. Businesses that don't want to enforce this, I understand that frustration. I understand that aggravation. I've sat in line where some poor cashiers had to argue with someone, please put on your mask. The person didn't care enough to put on the mask just to protect her. Shame on them, and shame on the businesses that aren't going to at least try to enforce it. I'm not saying they got to get down in the dirt, but at least try to enforce it. When I hear that we are turfing patients out to other states, it scares me. It truly scares me. I have my own health issues, and when I hear that surgeries are being canceled or that patients go into the hospital and no loved one can come in there, I know I've talked about the loss of my brother in September, but I was able to stand there and hold his hand. Prior to that, we had patients that died without family members, and the only thing they saw was the family on the phone. I don't want to see us go back to that. That is just scary. And I want to add that we can't just decide we're not going to make rules because there's somebody that's going to be out there protesting or somebody that's going to be out there screaming and yelling at us. We have to make rules for the greater good of the society, and we have it built into the Constitution of New Hampshire, and I think we should uphold it. So thank you.
Alderman Jettie.
Thank you, Madam President. Regarding enforcement, I agree with some of the previous speakers. I don't think we should decide what to do or not to do because we fear that it won't be able to be enforced. I mean, if that's your philosophy, you ought to do away with speed limits. We were out at the vigil tonight, and there were cars, speeding up and down Main Street. You could hardly hear what was going on because of the noise. In my ward, we have West Hollis Street. I'm always getting complaints about speeding on West Hollis Street. The police, do the best they can, but they don't catch everybody that's speeding. Does that mean we should do away with the speeding laws? Of course not. We establish a standard and we hope that people will abide by that. The fact that it won't be enforced perfectly should not prevent us, from doing the best we can. If we get, a certain percentage of the people to comply, I think we're doing the right thing. I want to acknowledge all the emails that I've got, and I'm sure everyone else has got a similar amount, but especially from the people from Ward 5 that have sent me emails. I haven't been able to acknowledge all of them because there have just been so many. But the arguments against the ordinance that we're being asked to pass tonight, some of the arguments are legal arguments. Now, I know a little bit about that. And the arguments that have been made were pretty much all dealt with last year when the city successfully defended a lawsuit against the mask ordinance that we passed last year. And two Superior Court judges, said that, the city does have the authority to pass this ordinance. The court, in the court's ruling, it acknowledged that the United States Supreme Court has, decided back in 1905, they decided that mandatory vaccinations did not violate people's constitutional rights. And the New Hampshire Supreme Court has similarly ruled that school vaccination laws did not violate the New Hampshire Constitution. And, and the court ruling quoted, as Alderwoman Klee quoted, about how certain laws are necessary for the greater good of society. And, this is one of them. So the legal arguments that people make about the violation of their rights and that we don't have the authority to do this, that was all dealt with last year by the courts. And, I can, assure people that it's a pretty basic principle that your constitutional rights are not defined by what you think they are. They're defined by what the courts say they are. And I acknowledge that people feel very passionately about this, but the courts have said, this is not a matter of a violation of constitutional rights. The other argument has been the medical argument. And, the arguments, range from masks don't work, COVID is not that dangerous, it'll just run its course. The dangers are exaggerated by Big Pharma and the media. The opponents refer to various sources to support their arguments. And those arguments are frankly lost on me because I'm not qualified to evaluate them. There's been a lot of conflicting information about the medical issues. I'm not educated in that. I don't know about that. But we have a Board of Health which is charged with protecting the public health. They have the qualifications and the expertise to evaluate all of this information. They listen to the opponents' arguments made at their couple of meetings ago. When all these arguments were made, they recessed. They took a week to digest the arguments, to research it, and they came back a week later and answered all of those arguments to my satisfaction. And they determined that we are in a dangerous crisis. They determined that masks are an effective tool in protecting the public health, along with vaccination, distancing, hand washing. And they are recommending, they're imploring us to pass this ordinance for public health and safety. And I'm not going to look them in the eye and say, thank you very much, but I'm going to listen to some other people who are not as qualified as you are. I'm not going to listen to you. I'm going to listen to the doctors, and I'm going to respect the time and effort that they've put into this, and I'm going to follow the recommendation that they've made. And I hope the rest of my colleagues see it the same way. Thank you.
Thank you. Alderman Schmidt.
Thank you, Madam President. My daughter's a nurse in Dover, the first hospital that came out and pleaded for help. I'd asked her how she was doing. She works the recovery room. She was taken from the recovery room to work in the ICU. The ICU was full. People were dying. She held hands of people who were dying. It was horrendous. We're doing terrible things to our hospitals by not paying attention. Every day I go to the DHHS website to see what's happened, the numbers that are following. Today's numbers haven't dropped, but I was told 19 people have died yesterday. 19 people died from complications from COVID. Over the weekend, 7 people had died. 4 of them, I believe, were younger than 60. I didn't know exactly how many in each age range, but they're younger. People are dying younger. Delta is dangerous for younger people. We don't know how bad it's going to be for Omicron. We don't know yet. This is scary. It could be just that it runs through the community and people get a little sick, or it could be that our vaccinations can't manage this. We do not know. The best way to prevent this is to prevent it. Wear the mask. Stay out of places where there are people who refuse. If there are people who won't comply, that's on them. If you go into a place and nobody's wearing a mask, I leave. I don't think it's fair of them to cause me to have less freedom because they want to go without a mask. I don't think it's fair. Our society is built on rights and responsibility. The responsibility is that you care about your community. Part of caring about your community is wearing the mask, especially when we have numbers like this. 19 died yesterday, 19, who wouldn't have died otherwise, just from somebody passing the disease onto them. Thank you.
Thank you. Alderman Harriet Gathright.
I'd like to say ditto to most of my colleagues here, but more importantly, I want to say thank you to the Board of Health. Thank you for the meeting that you had. I think it was about a week ago. I was on Zoom. I heard those that were for the mask. I heard those that were against the mask. But more importantly, if masks could save one life, then I'm for it. And as Alderman Jetty said, that this has already been in the courts, and we had already did this process. So for me, it's a win-win if we pass the mask. Thank you.
Anyone else?
Alderman Lou is online.
Alderman Lou.
Yeah.
Alderman Lou.
Thank you. I had actually a couple questions. Are we taking public comment tonight?
We are not taking public comment tonight.
Okay, and I just have two questions. I wanted to ask, so one of my Ward 6 residents asked about the increase and how, and could one of the doctors say what the increase in hospitalizations has been, like percentage-wise, in the last week?
Dr. Storrs?
We're getting the information.
Oh, okay.
Sorry.
They're looking it up.
Okay, so I'll just go on to my other comment. I just don't understand why we wouldn't, so listening to the two sides, it seems that some people feel like freedom is the right to go wherever they choose to go at any time. And the people on the other side say they have a right to be free of a mask anytime they want to be. And I just don't see how we're going to get a different response if we do this again, kind of similarly to what we did in the past. And I do feel that I don't understand why we wouldn't change the protocols for dining in bars. I understand, Dr. Storrs, you pointed out that people can choose to go there or not, but I don't think many people who we're trying to convince feel that that's the difference, or that's relevant. And I'm just concerned about whether we're going to do something that's effective. That's my concern. I had heard, I'd been told that the rates went up 5% in the last, I don't know, 3 or 4 weeks. And I just wondered if that's correct and whether that seems, whether that's commensurate with the change, the introduction of this. So I'm all set. Thank you. You can.
Dr. Storrs?
Thank you. I'm not sure of the question. I do know that Stephanie had texted me, and you might want to defer the question to Stephanie, Dr. Stephanie, regarding hospitalization. She made a comment that regarding the ER doctors and with patients and switching them to different hospitals. And she's hospital-based, so it's right up her alley. I think the question that you're asking me about the restaurants and bars, if I'm not mistaken, enforcement is a really tough thing here. I mean, and I understand that. And I think we as individuals, and one of the alder people, I'm not sure what the proper term is, I'm confused these days.
Alderman.
Politician.
Thank you. I just don't want to offend anybody. Said, basically, you walk in there, if they're not wearing a mask, you can walk away, and that's your freedom of choice to do that. If you decide that you think it's low risk, then you sit down. There's no way, other than testing a person 4 days hence, whether they caught COVID or not. But in the fact of going out somewhere, it depends on the setting. It depends on the number of people that are congested in an area. Depends on the load of virus that you get that converts you to COVID. Okay? So we know people can get in areas where there might be COVID, but there's a load within a 24-hour period that if you get high enough, and everybody's a little bit different, it isn't so many decameters for one person or for another. So what happens is you can get in that way as well. So when it comes to going out, it is an imperfect world because I have yet to figure out how to eat and drink with my mask on. And I don't mean that to belittle anybody, but just as light humor, we have to use common sense and say, look, if I have to take my mask off here and people are on top of me, or if I'm at a bar eating with people on top of me, this may not be a good choice. Did that answer the question? Because I'm not sure what the question was. Sorry about that.
No, thank you.
Okay.
It did answer my question.
Okay.
Yeah, it seems a lot of people can't understand my questions, but I just had a follow-up if I could, please.
Yes.
Thank you. I understood better what I was trying to say to you, but while you were talking, but it seems that my concern is that we're providing something so that our reasonable people who feel the way we do will be able to, I guess, exercise their, their choices. But it doesn't seem to address what the problem is that we have is people who won't wear a mask, people who are still going to be, it just seems that, really all this is going to do is irritate a lot of people, but it's not going to incentivize masks. So, and isn't that why we, would come out here to vote for this? That's my concern, but thank you.
I understand your concerns, and they're absolutely valid. In my world, in the perfect world, everybody would wear a mask. Everybody would be thin and not wearing stripes to look thinner. But we know we don't always follow the advice, just like Mr. O'Brien was saying, and I know he follows my advice all the time. But it would be great if we just said, you know what, we're in a crisis here. It's World War II. Everybody's jumping on the boat and going to fight. But that's not the case. Unfortunately, I wish it would be. I wish everybody would say, you know what, my New Year's resolution ahead of time is I'm going to make the sacrifice to wear the mask. It doesn't have to do about liberties or the Constitution. It has to do with I want to protect and love my fellow citizens. I want to make sure that they're with me next year so that we can party at a better time. That's all I can say. But unfortunately, not everybody agrees, probably, thank God, the way I look at this.
This is Dr. Stephanie Wolf-Rosenblum. Thank you for unmuting me and allowing me to speak. I failed to mention before, I reside at 47 Berkeley Street. So in answer to your question, Alderman Liu, hospitalizations are up 12%. And what the science of people becoming sick with COVID is that they become sick, and then after the first week is when they have an increase in complications and death. So that's what we call a lagging indicator. So hospitalizations being up are likely to be followed by an increase in deaths. And that will put an additional strain on our hospitals. You've heard some information from Director Bagley about the state in our hospitals. What I will tell you is I've had a personal conversation with the head of the emergency department in one of the hospitals, and what they said is that the reason people are being treated in the waiting room and in the emergency room is because they're calling hospitals in other states. 10 different possibilities, and the answer they're getting is, we're in the same boat you are. We're full, we can't help you. Last year, when COVID first surfaced, and we didn't understand that we were going to have to live with this disease, we shut things down. A lot of places, went into lockdown, and businesses closed. That's not what we're proposing here. And we're not proposing anything that's permanent. What we're saying is that we are in crisis now, and that we know one of the ways to avoid the crisis of any one of us or our loved ones going to the hospital and dying because there just isn't enough oxygen. There aren't enough respirators. There aren't enough doctors. There aren't enough nurses. This is not theory. This is happening throughout the country. And we don't want that to happen in Nashua. If not everybody wears a mask and not every business enforces it, and people take heed to the fact that the Board of Aldermen and the Board of Health have given this very serious consideration and are still recommending a mask mandate, I sincerely believe, and based on my discussions with people, I do believe we will have an increase. Studies have shown that mask mandates do lead to an increase in use. It's not 100%, but it can be enough to protect us. Thank you.
Thank you. Dr. Capetta?
No, thank you, President Wilshire. The discussion that Alderman Lou brought up was about, worrying to perhaps, maybe that's a strong word, worrying perhaps what the minority might be thinking about, okay? And what I mean by that is in medical school over 40 years ago, we're taught that the patient is always right. Listen to your patient. They'll tell you what's wrong with them, things like that. So once you graduated from med school, you start training. And I remember too, and my first job was down here in Nashua, that every interaction I went into the room, I was afraid when I said something that seemed to be opposed to what that patient was thinking about. Say, oh my God, I'm gonna lose them as a patient, they're not gonna like me, they're gonna spread the rumor that Dr. C is, blah, 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 and I would have sleepless nights. I'd say, what did I do wrong? What did I do wrong? And yet I could put my head on my pillow at night and say, everything I talk about with the families, and to this day, parents who've had me over the years, I always say, first and foremost, don't listen to anything I tell you. As if I'm telling you facts, I'm giving you my medical opinion on how we think your patient your family member could be treated. But do I expect them to perhaps listen to everything I say? So in those early days, I'd want them to go home and, go do this, go do that, et cetera, et cetera. And when they came back, I found out they hadn't followed the rules that I had set up as the doctor, I kind of said, wow, I must have been doing my job right. And I learned over time as a seasoned veteran now that I am, evidenced by the top of my head and the hair color, is that, I still say what I've said before, but I don't get caught up in the background noise. And I say that nicely because people's value systems, people's emotions, people's situations are different. So in my consultation with the family, we're going to have our private conversation. We're going to go set up a care plan. But as long as I can see it as patient-centered care that's based on true information they're giving to me, I'm going to do in my best abilities, give them the facts that they need. I feel like I've done my job. And that's kind of what we're asking you here to do, is we're hearing everybody's opinion, but in the case of the Board of Health here, we're just providing, in our best knowledge, science-based, and all of us three are scientists, and that we're just saying, we're just offering information that we feel is strongly going to protect and defend everybody's ability to survive this pandemic. Will they listen? Probably not everybody. Will they hope they do? Sure we will. Just like I'd like to think everyone thinks what I do is important in my office, but I know full well they may not follow through. But again, once they leave, I'm still going to defend them. I'm still going to work hard to try to maybe turn them around on the vaccine, not so much COVID, but any other day I'm talking about whatever, but I'm going to just, swallow my pride, if you will, and just say, all I'm here for is to serve you. And that's what the Board of Health is doing. So that's why, again, I implore you, let's not get caught up in what people think about us, how it may be perceived, but just say, hey, we're doing the right thing for everybody, and that's how we should think about this. Thank you.
Ask the public what they want.
Stop speaking out or we'll just disconnect Zoom. Alderman Clee.
Thank you, Madam President. While we've been sitting here and as my colleagues have spoken and as the experts have spoken, I have watched Zoom and I watched people making faces. I've seen people putting fingers down, people putting fingers up. These are people who are adults. These are people who we call grown-ups. I pray they have no children, but that is who they are because they're acting like children. And if we're going to act like children, maybe we shouldn't have any rules. But I think Alderman Jetty spoke it perfectly. Just because there are people, a group of people who say, I don't want any rules, doesn't mean we don't have them. Society needs rules. This is not a rule. This is a 4-week, or actually I should say a 1-month ask. That's all it is. Is there a provision in there that says, hey, we're going to extend it? Not really. It says that we got to come back and vote. We're going to have a new board. We're going to have different times, and we're going to have different numbers. I don't think it's a lot to ask of the public. So for those who feel that they can act like children and put up signs and put up fingers and make funny faces like a 5-year-old, please don't go to the restaurants because I don't want to sit with you. The bottom line is there are a lot of elderly people in my ward who can't go out of their homes. Elderly people who have a limit of life. Maybe it's 10 years that they have, but they have a limited life. And I'm going to ask them to give up one more day, one more week, one more month. And you can't give up a month. Shame on you. That's all I have to say. Thank you.
Alderman Clemmons.
Thank you, Madam President. I don't, I have to say, I turned my camera off so I don't make the faces that Alderman Clee was just talking about, because I'm frustrated with this conversation. To me, it's a matter of principle. I don't believe in mandates. I will never vote for a mandate. And so I understand the frustration that people have, and I understand the faces and the gestures and that kind of thing, because to me, it's especially annoying to me because we've had vaccines for almost a year. And, the folks, correct me, and the doctors can correct me if I'm wrong, but the majority of the folks who are ended up on ventilators in the hospital are those who are unvaccinated. And I find that is their problem and not mine. And that's where I come in with the frustration. So for me, I'm voting no on this for those two reasons.
Alderman Dowd.
I don't know which way this is going to go, but I would ask Director Bagley. We have 3 meetings. If this passes in the time limit of this, could you come back to each one of the Board of Alderman meetings in that time frame and give us an update?
Yes, sir.
Further discussion. The motion before us is for final passage. Director Bagley.
President Wilshire, did you want the number? I know that Alderman Liu asked for the availability of the hospital bed, so I just pulled this number up, and this information can be found on the state's website under COVID.
Let the public speak.
COVID-19.
Jeff, can you mute the people on Zoom, please? Sorry.
Yes, so this information can be found on the state's website, covid19.nh.gov. And for our I-93 corridor, the hospital group, where there's 13 hospitals, right now they have 221 individuals that are confirmed with COVID that are hospitalized, 3 that are people that they are still looking to get their results. The ICU bed availability is 2.8%, which is low. Total number of staffed hospital beds available is at 10.6%. So most of these hospitals are at capacity. And as I mentioned in our call with the hospitals on Monday, both of them reported very high census. They were holding patients in the ED. They had a high number of positive individual patients with COVID in-house. Most of the ICU beds were full. In fact, one hospital had all of their ICU beds full. And the other had to open up secondary ICU units. So our hospitals are being taxed, and this is right now, remember the graph that I showed, we're in a decrease, right? What we're asking for this next month is for coverings to be in place to keep those numbers down, because if the hospitals are already stressed, where we're in the downward slant right now, when those numbers go back up, this is going to be worse for the hospitals. Individuals that are there in the ICU beds, the majority of them are COVID patients, but some of them are not. It has already been explained that individuals that have COVID, if they're in the ICU beds, they're going to be there longer, which means there's no bed. God forbid I got into an accident tonight. There's no bed for me in these hospitals. And this is what we're talking about. We still have other things that are going on. One of our hospitals talked about people that are having diabetic emergencies, stroke, cardiovascular has gone up. As soon as that snow hits, you see more cardiovascular things, more heart things going on. You can't stress these hospitals any more than they're already stressed. And we talked about the fact that this is statewide. Dr. Stephanie Rosenblum talked about calling around, so that would mean we were even calling hospitals beyond, out of our state, Massachusetts, and there are no beds. So again, we're asking for something that would help all of us.
Stop firing the nurses.
The kids are gonna go on break, they've gotta come back to school. We don't wanna see the cases go up in the schools either. This measure of putting the mask on is just to slow and decrease the amount of transmission that's going to be in the community, because people are going to gather together for the holidays. People are traveling. We know that there's going to be more virus in our communities. We want to just stop the transmission of the virus in this time period. And we're asking for your help to get that done.
Alderman Brian, is there anyone else on Zoom, Alderman O'Brien? Members of the board?
No, nobody from the board.
Okay, any further discussion in the chamber? Alderman Karen.
Oh, thank you. I wasn't going to speak, but I have a question though to the board. How fast are you going to get this, if this is approved? How fast are you going to get this information out to the local businesses and get signs to them so that they can get them up? That's number one. And enforcing can be a real problem, because I know it was the last time we had this. Unfortunately, people who don't want a mask are not going to mask, and they don't care. And I understand what Alderman Clemens said, that the people who are in the hospitals are that have COVID are unvaccinated, but unfortunately they're taking up space of people who need those hospital beds because they have other issues. And if they had just gotten vaccinated or put a mask on, we wouldn't be in this predicament. I don't like to wear a mask, but I don't go out of my house without a mask on. And I know that some of the grocery stores, all their staff wear masks. And you're talking about an 8-hour day. We're out there maybe, an hour and a half. But I think it's important that as a community and as a society, we should be doing the right thing for our community. And it's nothing personal to the members of the board. We make that decision based on what we feel is right for our community, whether you vote yes or no on this. It's your decision based on what you feel is important to your community. Now, I thought about this all day since this came to us, because I'm thinking, a month, how are we gonna do this? But the more I hear, and the more I'm listening, I just feel that it's the right thing to do. And as Dr. Stura said, what happened to society doing the right thing for their community? And it's not about you, it's about what you need to do for the people around you, whether it's your family, your friends, or even strangers. So whatever the outcome is, we've made that decision. And those people, as Alderman Clee mentioned, that are putting up signs and yelling and screaming, you are not helping yourself. You are totally being disrespectful. So I've changed my mind, and I will be voting for this evening. Thank you.
Further discussion? Seeing none, will the clerk please call the roll?
You don't have the right to speak.
Alderman O'Brien.
Public comment.
Yes.
Speak at the voting booth.
Really?
Public comment.
We're not having public comment this evening. Jeff, would you please mute the people on Zoom?
Shut them off.
Public comment.
Yeah, we got
Yeah, we get two Alderman.
Jeff?
this is a
Jeff?
case for getting the news.
I could use some.
I'm helping you.
You don't have the right to speak.
Can you guys just please be quiet and let them finish?
We all know what they're voting for. Give us our chance.
So you're obstructing democracy?
Is there no opportunity, Jeff, to mute the people on Zoom?
We didn't get to mute you. Why are we getting to
This is not your meeting.
So let us talk.
I will not.
It is our meeting. We are the people.
Jeff?
How you guys can turn down.
I'm removing them.
Enough.
My recommendation.
We're not interested right now. We're in the middle of a vote. Would the clerk please continue to take? Would the clerk please continue the vote?
She's probably muted.
She's probably muted too,
Maybe
yeah.
Michael.
You can unmute yourselves.
No vote, no vote.
No, this is ridiculous.
We can't talk unless we fit the narratives.
We can't.
There's no video now.
Allison, are you able to take the vote? Allison?
Madam President, can't Alderman O'Brien do the roll call?
Can you hear me?
Yes.
You guys can on Zoom, but
Yes, I can hear you.
I can hear you.
All right, we're gonna start over on the vote. Alderman O'Brien will take the vote. Motion is for final passage.
Thank you, Madam President. Alderman Clee.
Yes.
Alderwoman Kelly.
all right, so now I think we're back.
Alderman Dow.
Yes.
Can you hear me in the chamber?
Yes.
Alderman Karen.
Yes.
Alderman Clement. Alderman Clement. Alderman Lopez.
Yes.
Alderman Tenza.
Yes.
Alderwoman Lowe.
This should be back on.
Alderman Lou?
Let's see, okay,
Alderman Lou, can you hear us?
Alderman Clemmons is saying that they lost sound online.
Haven't called him.
Could Alderman Clemmons and Lou call in and
That's what I
register
just
their
told him,
votes?
yeah.
That would not be legal,
Okay.
Alderman Jettie. Madam President, with corporate counsel's permission, do you want me to complete the roll and then stand by until the other aldermen are present to vote?
Yes. Mm-hmm.
Okay, I will continue the roll. Alderman Jettie?
Yes.
Okay, did I already call you?
No.
Okay, good. Alderman Jettie?
Yeah, that was a yes. not-
Yeah, I got you. Alderman Schmidt?
Yes.
Alderman Laws is not present. Alderman Claver?
Yes.
Laws is not present. Alderman Claver?
Yes.
Alderman Harriet Gathright?
Yes.
Alderman O'Brien votes yes. Alderman Wilshire
Yes.
votes yes. Alderman Clemmons?
No.
Alderman Clemmons votes no.
Alderman Lou.
Alderwoman Lowe
Yes.
votes yes. Madam President, I have 12 yeas, 1 nay.
Tyrants.
And that motion carries. Ordinance 21-083 is declared duly adopted. Alderman O'Brien, do I have a motion?
Yes, you do. Madam President, I would like to make the motion that the December 21st, 2021 special meeting of the Board of Aldermen be adjourned by roll call.
We won't comply.
Jeff, can you please mute the audience? The Zoom? So what?
Not easy.
Yeah, it's kind of like
Thank you for coming.
The motion is to adjourn. Will the clerk please call the roll?
Thank you, Madam President. Alderman O'Brien votes yes. Alderman Clee?
Yes.
Alderman Dow?
Yes.
Alderman Karen?
Yes.
Alderman Clemmons?
Yes.
Alderman Lopez?
No.
Thank you. Alderman Tenza?
Yes.
Alderman Lou?
Yes.
Alderman Jettie?
Yes.
Alderman Schmidt?
Yes.
Alderman Cleaver?
Yes.
Alderwoman Harriet Gathright?
Yes.
Alderman Wiltshire?
Yes.
Madam President, you have 12 yeas, 1 nay.
And we are adjourned at 9:18 PM. Thank you, everyone. Thank you to the Board of Health. Thank you very much for being here.
Thank you. So just a reminder, we have a meeting of the Planning and Economic Development Committee is held.
It says they're not covered by COVID-19.
All right, so folks, if you're not gonna allow us to conduct the meeting in an orderly manner, we're gonna have to mute everybody. As I mentioned, a meeting of the Planning and Economic Development Committee was held Tuesday, December 21st at, the time is now 9:24 PM in the auditorium, in the chambers and via Zoom, with the meeting link, which can be found on the city's agenda, and on their website. I am going to clerk, this evening, and I will first call the roll. Alderman David Tenza is here. Alderman Jan Schmidt.
I am here.
Alderman Thomas Lopez.
Here.
Alderman Ben Clemmons.
I am here. I am participating via Zoom. There is no one in the room with me, and the reason I'm participating via Zoom is due to work commitments.
Thank you. Alderman at Large Brandon Laws has indicated he is not able to make it tonight. So we have 4 members present, so we do have a quorum. Also in attendance is Matt Sullivan, Planning Manager, and Director Tim Cummings of Planning and Economic Development. The first item on the agenda is public comment.
Alderman Clee is also present.
I'm here.
Oh, I'm sorry. Alderman Clee is also joining us. First item on the agenda is public comment. Anyone in the chamber? Ms. Ortolano.
Hi, yes, Lori Ortolano, 41 Berkeley Street. I just want to say, you know, the scheduling of these meetings, I just think wasn't done correctly. You know, to schedule 15 minutes for the first meeting was absurd, given the topic. And that was without community input. You know, it's over 2 hours and 10 minutes later that we're sitting here in an economic development meeting. And I take great offense to the comments made by Alderwoman Clee regarding public behavior. You know, I didn't participate in that behavior, and it's not that I condone it, but I feel I've been in a lot of board meetings where I've seen similar behavior from the board members here. I have watched people get on their phone. I have watched Mrs. Wilshire, President Wilshire, wrinkle her face, make faces at me, cut me off. I've watched Attorney Bolton interject out of the rules of order of Robert's rules. I have watched people use their cell phone. I have watched alderwomen on Zoom go on social media, you, Jan, type in social media comments while you're present as a board member. I've seen it all. And I've had to put up with that. And I think to call citizens out as children with poor behavior, it doesn't do any good. And it's not to the benefit. I mean, tonight you chose not to have public comment, and I emailed President Wilshire to ask her if you were going to do a reading and place this as an item to be acted on, would you allow comment? I didn't even get the courtesy of a response. You have the right to allow no comment, and that's fine. But I participated in the Board of Health meeting 2 weeks ago, and a lot has changed in 2 weeks. And I would have challenged some things that these health people said. I've got a letter from the president of Southern New Hampshire, who just put his letter out today, saying we've come over the hump, we're coming down, and things are improving. I would have read that into the record. Hospitalizations that Dr. Wolf, who is my neighbor, said were up 12%. Since December 3rd, they're down 5%. We've gone from, we're down around 437, which is what we were on December 3rd. The big surge came from November 15th to December 3rd. And the way this is handled with the one-sided view, I have supported the Board of Health, I really have. I've been a big fan of theirs, and I understood the difficulty. They no longer have my support for what was said in here tonight. And I do my research. So it's just really very disappointing, Alderwoman Clee, to hear the scolding that goes on, because you're the one who says, hey, we're at the board, we have to take it any way it comes, we can't, you can do whatever you want to do. But you really don't take it. It offends you. But I've been offended so many times in this chamber, and I wish you'd consider that. Thank you.
Thank you, Alderman. Anyone else in the chamber who'd like to speak? Public comment? Come on up. And I apologize, our timer's not working, but I'm still giving folks 3 minutes.
Okay.
I'll give you a 30-second warning.
Bob Keating, 5 Coburn Woods, Unitarian Universalist Church and Granite State Organizing Project. I just want to make sure that remarks about the inclusionary zoning is appropriate at this time?
They are, yes.
Right, okay. First off, I appreciate hearing the input from the board on the previous issue, and it's a very important one. So you've all heard me on the previous moment, but just for the record on this, I'm very much in support, and as is Granite State Organizing Project, for the revised ordinance for the inclusionary zoning. I think it will be helpful in terms of a step forward. From my remarks that we had hoped in some difference on the income levels, but we're embracing it at this point, and as it moves forward, and hopefully it's a final passage in the future, that hope that we can reduce it to for more affordable levels. So thanks again for all the work, and for our 2 gentlemen here, and Tim, and for their efforts, and Sarah Marchant, beforehand. So appreciate it. I think this will be one more thing to add with to increase the people having less stress in terms of their housing costs. So thank you again.
Thank you, Mr. King. Anyone else in the chamber? Seeing none, I see online Reverend Basada.
Thank you so much. You have already heard from me today. I feel that I don't need to make all of those comments again, except to express gratitude once more for creating an amendment to inclusionary zoning to make it mandatory. We believe, as I am a representative of the Greater Nashua Interfaith Housing Justice Group, as well as Granite State Organizing Project, we all believe that this is an important component for housing justice for Nashua, and we just encourage its approval so that we can move forward with this. Thank you so much.
Thank you. Rabbi Spira Savet.
Mr. Chair, can we remind people to use their name and address for the record?
Yes, thank you, Alderman Lopez. Rabbi,
Apologies. 12 Nutmeg Drive in Nashua, Christy Basada. Thank you.
Rabbi, please go ahead.
Sure. I'm Jonathan Spiros at 39 Coburn Avenue in Ward 1. Again, like Bob and Reverend Basada, I'll echo their comments. I just want to add that really have appreciated that our groups over the past 2 or 3 years have been able to work with you, members of the committee, leaders of the departments and the mayors, and also other citizen groups and people in the private sector, and really hoping that the adoption and then the implementation of this inclusionary zoning will continue to be the model for how we work together on the next steps around these things in terms of serving more people and developing more strategies. And just want to, on behalf of all of us, let you know that you have partners in the community, and maybe partners you didn't realize you had a few years ago, who are really ready to roll up our sleeves and collaborate with you. And thank you for the time you're taking this evening.
Thank you. Robert Lodi, would you please state your name and address for the record?
Chairman, my name is Robert Lodi, 12 Bartlett Avenue. I just have a couple slides with some text to help make my point. It just seems like we're having some communication challenges with those on Zoom. But first, I want to open and thank you, all the members of Planning and Economic Development and the broader board, the service to our city. And as that last Special Board of Aldermen, your work is challenging in the best of times, and these are not the best of times. So I commend you on the work you do in service to our city. Just a couple slides I'll put up if I may. Oh, it sounds like we're not able to unless Mr. O'Connor will allow it. But anyway, if that's not okay, I'll just speak to it then. I'm speaking here with respect to R21203, the purchase of the property adjacent to Greeley Park. I'm here to urge you to pass this out of planning and economic development and send to the board with your recommendation. There are a number of facts I'd like to cite for you, and then some I think are self-evident to any of us. But the Trust for Public Lands and the return on investment in New Hampshire land study for 2014 showed that residential land consumes $1.12 in services for every $1 in taxes it generates. So when we look at development, it's not the economic panacea that some I've heard from that have spoken to this board have made. There are genuine costs that come along with that growth. Secondarily, Greeley Park is a jewel in this city, and I don't have to tell anyone that's been there. But if you go to TripAdvisor, and I had a screenshot of it, TripAdvisor lists Greeley Park as the #2 thing to do in Nashua, #2. And TripAdvisor is one of those internet, World Wide Web welcome mats for the city, right? Visitors coming to the city, looking what to do. People who may relocate here, new residents, look for what to do. And Greeley Park is at the top of that list of things to do. There is no underestimating the value that being outdoors in nature has for our physical and mental health. And what we saw with all of the energy around the mask mandates, the need to be able to be outdoors for both our physical health, socially distanced, and particularly the mental health of children who have just taken an absolute beating over the last 2 years. The more that we can get them outside and playing like kids. So anything we can do as citizens and you as our leaders to help preserve, protect, and defend Greeley Park for another 125 years. And I hope some of you have walked that. And you'll see just how integral into the park that piece of property is. And it sits basically in the front between land the city already owns and Greeley Park, which the city owns by grant from the Greeley family. So it is part and parcel to the park. The park is an essential bit both economically and to the physical and mental health of our citizens. And I know 125 years from now, your descendants looking back would have a measure of pride that you were the board that took action to protect this vital piece of property. So I'll close my yap at this point, not easy for me to do. And again, just close with my urgent pleas to pass this, send it back to the board with your recommendation. And again, thank you for your service to our city.
Thank you, Mr. Lodi. John Ferreira, name and address for the record, please. Mr. Ferrera, would you like to say anything?
He's muted.
All right, we'll,
Hey, can you hear me?
yes.
I was on mute for so long, I couldn't unmute myself.
No problem.
And my name is Penny Ferreira. I'm using my husband's computer. Penny Ferreira at 3 Birchwood. And I echo Mr. Lodi's thanks and appreciation. You do not have an easy job, and thank you for the opportunity to come to you again and speak about our 21203. And just by the way, I double mask, so it's very important. It saves lives. So I just wanted to, last time I stood up and I held in person, I held up what I thought was the most current master plan for the city. And graciously, Mr. Sullivan sent me a text and said, I think you had the wrong one. So now I have the right one. So I'd like to share some information with you. Greeley Park and the Bartlett property next to it is a really tough one because you do have a right as a landowner or a beneficiary to sell the property. But I also learned from Matt and also from your economic development manager, Tim Cummins, that as a citizen, all of us have a right to say our opinion of what we think land should be developed and how it should be developed. I wouldn't be making a cause for this if it wasn't for the fact that any development has the potential to go forward and with the kid's desire to sell that land to a developer, whether it is Lloyd Geisinger or anyone else. So I'm hoping that you heard from all your constituents when you gave us more time, and gave people time to find out about it and express for every ward. Also, the last update was that Ward 3 was not the highest number in people that responded to the change.org, that it actually was a combination of all the other wards. So you're hearing from people in the city as a whole who care about it. But I now have the current master plan, which one in the introductory, it says to maintaining the balance of access and to protect our natural resources. You will find that phrase all throughout this updated version for the plan going forward. Again, on page 159, protect natural resources, carefully balancing public access and community use of preservation.
30 seconds, ma'am.
Okay. So I want you to think about the historical value too, because you have a house on that property that was also built by a historical builder, Royal Barry Wells. And you talk about increasing bike paths. You talk about increasing programs to educate and teach younger people good stewards. Anything that is done on that property is going to affect the quality of Greeley Park and how people enjoy it. I am asking you tonight to please give the mayor your recommendation to purchase that land, because you have a legal right to do that. You have a plan forward to increase the public spaces of the parks that is written throughout your 2021 master plan. Thank you very much.
Thank you, Ms. Ferreira. There's someone here who has not identified themselves with their name, who has their hand raised. If you'd like to state your name and your address, please. You have 3 minutes.
Mr. Bourne is also there.
Okay, I think they put their hand down. Mr. Bourne?
Good evening, and thank you for the opportunity. Bob Bourne, 28 Farley Street, and I too am talking about the Bartlett Street property, R21203. We know that the development on that property has hit a snag today by the current developer. And while I don't know the reasons for their decision to, at this point, pull out, I think it's reasonable to assume that they've included the factor of the community uprising that is fighting against that, but perhaps more importantly, a good business decision based on the cost risk analysis of the development. And I say that, for example, we know there's an awfully large amount of ledge in the park area. Imagine what the cost is to remove that. Initially, the development was caught us all by surprise. I believe that the city had no advance notification, the neighbors had no notification, the abutters had no notification. There was no public disclosure. Using an earlier comment by Director Tim Cummings, he mentioned the need for public-private balance. Well, in this case, there was no public-private balance. Thankfully, now as the developer is exiting, we have a moment to plan and add balance. To help make a citywide plan for the addition of Greeley Park, for the property, if the property is developed, the addition of Greeley Park will never be available to us again, ever again. We can't make that mistake. Please use your good judgment about how we're going to address the 13 plus acres that are abutting our beautiful city park. Let's add to the park. We have a little time, but not much. Now is the time. We know that there are a couple of contingency offers. Now is the time to act, so this doesn't get away from us, so this doesn't surprise us again. We don't know what's behind door number 2. We know the community is well organized and will be aggressive in the opposition of any development next to Greeley Park. We know they've hired a law firm to help assist in this process. If you vote to make the recommendation for the city and the city approves the bond,
30 seconds.
we know we won't have to be back here again in months or perhaps even years making similar arguments. The preferred outcome for the community is for this property to be purchased by the city and added to Greeley Park. I would ask you to help the community do just that and vote in favor of that. Thank you and appreciate your time.
Thank you, Mr. Bourne. Mr. Richardson. Sorry, Mr. Richardson, you're muted. Still nothing. Can't hear you. Can't hear you, sorry, sir. We'll try Mr. Camo, and then we'll come back to you, sir.
Yes, thank you, Alex Camo for Lewis Street. I spoke briefly to this in the infrastructure meeting a week or two ago, and I think that, at least from my perspective, a lot of the people I've spoken to that initially were against this proposal were against it because of a lot of misinformation that has been going around, particularly on social media and the change.org petition. People were under the impression that some developer was going to come up from Massachusetts and build houses in the middle of the softball fields. And the fact is that most people, if this development went through as planned, the people that use Greeley Park every day, the majority of them would never notice what changed, except for the people that walk a very specific walking trail on the west side of Concord Street. The picnic areas, the hat shell, the athletic fields, the public gardens, none of that would be affected. The park, is not in danger. So people coming on and saying we're going to save Greeley Park, protect Greeley Park. I use Greeley Park as much as anybody. And the fact is this development doesn't endanger Greeley Park. Parks and Rec has no plans to further develop the western side of Greeley Park. There's no plans of use for this land. And the other thing that is a hot topic in the city is the lack of housing. So it just doesn't make sense to me to hold up a development deal over a phantom fear of destroying the park that doesn't exist. And it's not the city's job to purchase every piece of land that goes up for sale that could potentially be used for something that some neighbors don't like. And that's going to happen. In every neighborhood, there's going to be something that comes up that some neighbors might not like. We can't go around as a city and spend millions of dollars buying up every parcel of land that goes up for sale because we're afraid of what might go into it. That's all. Thank you.
Thank you. Mr. Richardson, you're unmuted on our end.
Can you hear me now?
I can, yes, thank you.
Oh,
Go ahead.
that's great, thank you. I think I fixed it on my end too. I don't want to elaborate, but I wanted to mention that those items mentioned by, the facts mentioned by Mr. Lodi, Ms. Ferreira, and Mr. Bourne, I'm fully in support of what they support, and that is, preservation of Greeley Park. Number one, expansion of Greeley Park where possible, because it is virgin land, it is available for a price, and there's no way that it could ever be possible again. There's no other land available. It's a golden opportunity, and like was mentioned before, Greeley Park is the number one, well, it was mentioned number two. For me, it's number one attractive feature in Nashua. And Nashua, as we know, with the failed branding initiative, has been searching for an identity. And it just, it is the closest thing we have to an identity. Anybody that ever mentions Nashua, New Hampshire, mentions Greeley Park. So I'll leave you with that. Please approve it and make it possible to purchase this land, or at least perhaps the owner would be interested in selling a part of that land. But we need the money approved and available for bonding to do that. So thank you very much.
Thank you, Mr. Richardson. I see no one else online who has their hand raised. I see no one in the chamber, so we will move on. We have two communications, one from Matthew Sullivan, Planning Manager, regarding referral from the Board of Aldermen on proposal R21073 relative to the authorizing the purchase of property located at 15 Bartlett Avenue, map 57, lot 3. We also have communication from Matthew Sullivan, Planning Manager, regarding referral from Board of Aldermen on proposed O21073 relative to amending the inclusionary zoning supplemental use regulations. There being no objection, I will accept the communications and place them on file. There's no unfinished business. First unfinished business resolution is R21203, authorizing the purchase of property located at 15 Bartlett Ave, map 57, lot 3. I look to Alderman Schmidt for a motion on R21203.
I'm sorry?
Would you like to make a motion to recommend final passage of R21203?
I'll make a motion to recommend final passage for Resolution 21-203.
Okay, thank you. We do have the resolution's primary sponsor, Alderman McLean, here with us. Alderman McLean, if you could please just talk to the resolution.
I will. Thank you very much for letting me speak today. This is a companion bill to R-202, which is actually the bond. It was, I thought it was tabled in the Budget Committee, but it wasn't. It was a recommendation to tabling, so it will be coming to the Board of Aldermen on the 28th of December with that recommendation, and we can talk to that at that time. What I want to talk to you about is the authorization to purchase. That's what this particular one is. And I believe all of the Board of Aldermen received an email that I forwarded today relative from a constituent who gave me the Greeley Park, a brief history, which was submitted by the Friends of Greeley Park to the Board of Aldermen in 2013. And here it states, Joseph Thornton Greeley, 1823 to 1881, in his will, left to the city of Nashua his farm known as Greeley Park, consisting of 160 acres, more or less. He wrote his will 2 years before he died. Greeley's 3 sons died of scarlet fever at an early age. His remaining children, both girls, were both under 18 years of age when he died. Joseph Thornton Greeley is a direct descendant of Matthew Thornton on his mother's side, one of the signers of the Declaration of Independence. On his father's side, he is descendants of patriots who fought at Bunker Hill and Lexington. His children and grandchildren are all listed as sons and daughters of the American Revolution. It was some years before the Greeley Farm was turned into a park as per his wishes. Great thought by the city of Nashua at that time was given to the laying out of the park. Mr. John Cotton, a prominent businessman in the city, donated $5,000 to the city for the laying out of the west side of the park. This is the west side. The city matched his donation in 1908. On the night it was announced, there was celebration in City Hall. The Board of Aldermen meeting that night went from 7:30 p.m. until midnight. Such was the overwhelming celebrations. Mr. John Cotton, some years later, gave an additional gift to the city consisting of a resting house, known locally as the Stone House, a fountain, walkway, and fresh spring water drinking fountain. The Stone House is the city's most iconic spot. After his death in 1912, Mrs. Cotton continued with the beautification of the west side of Greeley Park. The city employed Mr. B.K. Howard, a landscape architect from the Boston Parks. The superintendent of the Boston Parks came up to Nashua, as recorded in the City of the Nashua Annual Report. At one point, during the laying out of the park, and left behind him one of his senior foresters, Mr. E.O. Hathaway, engineer, surveyed the farm. The superintendent of the Boston Parks was at the time working with the famous firm of Frederick Law Olmsted on Franklin Park. Also, at the same time, the Anderson Estate, close to Greeley Park on Concord Street, had the firm of Frederick Law Olmsted employed to do the landscaping on their property. The firm of Frederick Law Olmsted employed Mr. J.P. Cotton, an engineer. Probably John Cotton and Mr. J.P. Cotton were related. Greeley Park has always been considered the gem or crown jewel of the city's park system. When the city had its 75th anniversary, it was hosted at Greeley Park, where thousands of its citizens celebrated for 1 week with parades, children's doll carriage parade, and the like. Many famous people came from all over New Hampshire for the celebration. Through the years, Greeley Park has been much loved by its citizens, but in its past 30 or so years, it has been eaten away bit by bit. Of the 160 acres, more or less, left by Joseph Thornton Greeley, the City of Nashua Assessing Department presently has a record of only 125.14 acres. Presently, there's a moratorium against any construction in Greeley without approval from the Board of Aldermen. On the west side of Greeley Park, there is a natural spring running through it. In 1932, the National Telegraph reported that this spring has medicinal properties, whereby local doctors and reported that their patients benefited greatly from the drinking of this water. Many local doctors were sending their patients to drink from the spring water. Pilgrims came from afar with jugs to fill the waters from the spring. The Commissioner of the Parks had a list of people from Nashua and Hudson who reported that this spring water had benefited their ailments. Water samples were sent to Concord by the health inspector, and the Telegraph reported the sample was excellent. The annual report of the City of Nashua for that year included that the health inspector had indeed sent samples to the water to Concord. The archives at Concord have confirmed how many samples were sent. Presently, there is a capped well in the area of the spring. Those of us who walk the west side see that, and truthfully, up until I had read this report, I often wondered what that was. So to think that we have this famous spring on there tells me that the west side is as important as any other portion of the city. It's extremely important to me that we consider what a development literally in the armpit of Greeley Park. And I call it the armpit, somebody referred to it as the elbow, and I say no, because this is all of Greeley Park here. There's this piece of property that's literally right here, and then there's another portion that's may or may not be part of Greeley, but it's also part of the city property. It's up on Columbia. There's a tiny little piece of Pennachuck, but there's a larger piece of Columbia. That's where, believe it or not, the water tank for the North End used to live. There are springs in through that area. There are some homes that are on Bartlett that still have wells. This will affect, any development of this property will affect them. There will be blasting. The previous developer, and I say previous developer because he has since pulled out. He is no longer the developer of record. I do believe that there are other people waiting in the wings, and I'm not going to comment on that one way or the other. Mr. Geisinger had said that he would step away if the city wanted to buy it. There's been a lot of outcry from the public. I do not know. He sent me a letter today telling me that he was pulling out, did not give a reason, and I did not ask. That is his reason and his reason alone. I believe him to be a very good man. He kept his word. The problem that I see here is that we need two things. We need a bond and we need the approval to purchase it. Approval to a purchase it only takes a majority. The bond takes 10 votes. It is going to be a hard hill to climb. Somebody said, did you get permission from the family? Are they interested in it? I don't know. I can't do that. It's not appropriate for me to go and knock on their door. But the bottom line is I do believe that we need to show good faith. We need to show that we're ready to pay that mortgage if and when we can purchase it. It's kind of like getting pre-approved. So let me talk about the park. This, as I said, sits right here in the armpit of Greeley Park. To remove that property, and anybody who walks and I'm sorry that someone felt that, it's only the west side and only the people who walk that park benefit from it. It's not true. Any Sunday you can drive to Greeley Park and you will see Massachusetts place like crazy. You will hear people who say, well, we're losing $650,000 in taxes, but how much is that going to cost us? The first year those roads will be private, only the first year. We know we get it all the time. We bring these private roads into the city. That's a cost to the city. That's trash pickup, that's road cleaning, and eventually it's also the taking care of the roads. So the issue of saying that we're losing these tax dollars is not quite completely accurate. We need to show that we are willing to purchase this. We are willing to save Greeley Park. And I agree to one of the speakers who said that there was misinformation out there. It never came from me. Anybody that heard me speak always heard me say, this development is not in Greeley Park. It abuts Greeley Park. It only abuts Greeley Park. I'm sorry if misinformation went out there, but they never heard it from me. I think that the removal of these trees, and just to let everybody know, there is wetlands there. I don't know if they've done any kind of on-site study, but I have a feeling that there are vernal pools there. It's up in the upper corner of it, may or may not be affected by it. I'm also going to tell you one other thing, and this is not a NIMBY, but any development is going to affect those people there, and not because they don't want it in their backyard. You can speak to any of the residents there. Their water pressure is horrendous. I spoke to one gentleman who's 2 streets away, Elliot. He put in a pump, and he still has very low water pressure. It just saddens me that we have people that are on wells that could be affected by this because of the blasting. We have people who have water pressure issues who could be affected by more housing being put in there. I agree, we do need more housing in the city. I just fear that this housing will have a negative impact on the city. It will have a negative impact on the park itself. I think, if I remember correctly from the planning committee, this falls within the master plan, even though, as does housing, this falls with keeping with the master plan thinking. We need to save the lands. We need to have as much green space as possible. This is not the same thing as going to every neighborhood and saying, no, we're not going to do it, we're not going to do it, we're not going to do it. This is different. This truly is, as you heard from the Friends of Greeley Park, it is one of the gems. It is the #2 on TripAdvisor. I really think that we should look at this. I think we should give it a favorable recommendation to the Board of Aldermen, and then I hope on the 28th we can carry it forward. I just want to add one more thing. It is kind of just a side note. If what happened a short time ago is any indication of what can happen, the neighbors there had their water shut off. Pennachuck shut their water off with less than 24 hours notice. Some people never even got the notice and they were without water. These were families who had no water in their home. And it was shut off because of something that needed to get done in that property. I don't know what it was, and I assume it was an emergency. But this is something that can happen. So we need to really, really keep in mind there are some real issues there. And thank you very much for hearing me.
Thank you, Alderman Klee. Questions for members of the committee? Alderman Clemens.
Thank you, Mr. Chairman. I agree with Alderman Clee on this particular issue. I think that a development on this site would be detrimental to not only the park, but not really in the best interest of the neighborhood or the city as a whole. We have an opportunity. It's not every day that an opportunity comes to expand a park like Greeley Park, and to do so in a meaningful way. This presents itself, as a once-in-a-lifetime sort of opportunity. So I think that, yeah, it is an investment. It's an investment in the park. And what we would be doing is adding this tract of land to Greeley Park so that we can protect it for the future. And that's an investment in our future. And all of our city parks are for all of our residents. So I don't prescribe to the NIMBY idea either. I had a development that was built directly behind my house. There was a few others that happened after that in my neighborhood. And we had folks who were against it and, against the development and everything. But I never went to the planning board. I never went to the zoning board and spoke, I never spoke out in opposition to anything that folks were doing. I was asked to by some of my neighbors because I was on the board of aldermen, but I didn't do it. And the reason being is because the land, while it was open or while these projects had a impact on the neighborhood, they weren't of the same type of significance. I mean, certainly personally to me, the fact that there's a senior housing now that's 3 stories tall and, there's 60 people that live back there. I mean, that certainly affects me, but it fits with the neighborhood sort of, and that's the other thing that we need to consider is the fact that would a project like that fit with the neighborhood? And I really don't think that it would. So rather than letting the opportunity go by, I suggest that this board should recommend that we pass this legislation to buy the property, and hopefully we can move along the other piece, which is the bonding portion of it. And at least this sets in motion the ability to negotiate with the property owner. Now the city can go in and we can talk to them and we can see what kind of deal we might be able to work out. And maybe we'll get the whole thing, or maybe, as former Alderman Richardson said, maybe we'll only get a portion of it. Maybe we'll work on something so that there's a buffer in the back that kind of it's a compromise. But we can't have these conversations unless we have some piece of legislation that allows us to move forward with that. And so this is what this is, and I hope that it will get the support of the committee tonight. I was happy that it got the support of the planning board, and so I am hopeful that the committee members will send this forward with a positive recommendation. Thank you.
Thank you, Alderman Clemmons. Alderman Lopez.
I want to start by thanking Alderman Clee for her comprehensive and historical presentation. And I want to remark that her residents are extremely lucky to have her. Hope you don't mind me sharing this, but I think maybe it was a week ago you were telling me you had been given exercises to reinflate your collapsed lung.
Yes.
And so to be able to deliver that kind of impassioned exposition is impressive. And it reflects, none of it was filibuster. It was all very interesting content. And, after such a long meeting, I think it's pretty tempting, for legislators such as ourselves to kind of just roll in and maybe have a little bit less of an intensive, lobbying effort to the other members of the board. Not in this case. Alderman Clee gives it 110%. She cares passionately about it. Her residents also sat through the last meeting and all of the accompanying mayhem and came forward to make their cases. This is very important to the community. I think they're onto something. I think they know their ward and their neighborhood very well, and I think there's an intrinsic wisdom there that the rest of us should be following. I hope the rest of the board does intend to support this. For me, it's a little bit of an easy sell because I already supported the bond, so it's kind of foolish for me to not let anybody do it. As was pointed out in public comment, it's not the city's responsibility to seize every piece of property that neighbors around it think might be used for something that they don't want. Not at all. But we don't have a lot of green space left in Nashua, and it is rapidly vanishing. There are a lot of development projects that are underway, and we do have an obligation to make sure that they're ethical and consistent with the needs of the community. The same way as the tannery project. We're trying to make sure that they don't create an environmental disaster while also, developing usable land and respecting the rights of the private owners of that property. So the city's not trying to claim this by eminent domain. They're trying to make a fair offer so that the residents have equal playing field to say what is going on in their neighborhood. And I think that is something that, as legislators and aldermen, we do have to attend to, because they're taxpayers too. They're contributing to our city budget. They're contributing to the resources we have and our AAA bond rating. And when they come to us and they say, something's about to happen to an asset for the entire city, which also directly affects all of us, they have a right to express that. And they have a right to educate us on what that immediate area means to them, how it's used, and the different players in the area. I didn't know that there's a Christian school over there, or that there may be vernal pools. Apparently the Fountain of Youth is located there. These are things that you find out from people who know the area and treasure it. And these are amenities that you can't build. We've just spent years trying to design, develop, and find the perfect place and location for a performing arts center. You can't create a forest. You can't do that. Okay, you can with like 30 years and a whole bunch of patience, but you can't add the history to that area retroactively. This is an amazing opportunity. And finally, I'd like to point out that in Ward 4, we missed the boat on that very early in my aldermanic term, because an adjacent piece of private property was developed further and turned into essentially a parking lot, and didn't even trigger anybody's radar, because there weren't residents right in that area saying, wait a minute, you're about to build a parking lot about 8 feet from a trail. And now that's the part people know. Like, Greeley Park used to be virgin land. It used to be very unspoiled. It has been developed by public works. There's a soccer field in the middle of it. There's baseball fields. Those are amenities that neighborhood children and local organizations and the city enjoys. But it's not a deep woods trail. It's not the environmental and conservation experience. And that's something that we owe it to future generations of Nashuas to preserve for them, so that they have that experience and they have that ability to do it. Because many of us had the opportunities, I had too much of an opportunity growing up in a log cabin in the middle of nowhere, to understand nature. Inner city kids don't. And if we make it too far away from their backyard, they don't get that opportunity. So I appreciate the advocacy that I've seen here tonight. I appreciate the cause and the argument. I plan to support this, and I look forward to supporting it again at the Board of Aldermen. Thank you.
Thank you. Alderman Schmidt.
Thank you. What's the zoning there? Do you know how it's zoned?
The zoning is at R41?
It is RA.
RA.
RA zone.
And what is that entitled?
The minimum lot size is 7,500 square feet. That's the base zoning there. It's residential zone.
So it's not protected because of the water that's there? There's no wetlands associated with it? Thank you.
So Matt Sullivan, Plan Department Manager. My understanding is that there has been a field delineation of wetlands. However, we have not seen that formal wetlands delineation. I believe there is a small pocket of wetland area on the site that does constrain the site's development.
The piece of property they're looking at only has one entrance, is that correct?
The proposed configuration included only one entrance with the development that was least floated to the neighborhood. That was not submitted to the city, but that did include one entrance only.
And the road that it dumps out on is all residential homes with, how much, are they zoned A as well?
They are comparably zoned. The parcels adjacent to the proposal are a mix of lot sizes from 0.3 acres all the way up to 1.8 acres in size, I would say, in the general vicinity.
As far as traffic goes, if they were to build it as they've, designed it, that traffic dumping out on that street, do you think that would be, the street would need to be upgraded or widened, or?
It's very difficult to say. Based on the number of units, they would have to go through an exercise with the engineering department to determine whether or not a full traffic study is needed or whether basic traffic treatment could treat.
So at this point, what we're really looking at is, it's an idea. It hasn't gone through planning, it
Correct.
hasn't gone through zoning. None of this has been put forward at all yet.
That is correct.
Thank you.
Mm-hmm.
For a lot of reasons, I don't like the housing there. But for a lot of reasons, I don't like the $2 million price tag. Hearing from Ward 1, people don't like it. They think it's, not in my backyard, and it's perfectly understandable. In Ward 1, we have access to the central park of, this city. That's the one people use there. And I can't get any buy-in from the people in Ward 1. They think Greeley Park is that part on Concord Street that is just, for picnics and movies and such. They never have gone up in there. They don't understand why it can't be purchased by the people in the neighborhood to give to the city. We know that there is a lot of opportunity for grants and such for things just like this. As a matter of fact, there have been 2 very big ones recently in New Hampshire. So I really have a hard time voting for this. That's it.
Thank you. Anything further? Alderman Clee.
Thank you very much. I completely respect that, and I do see how oftentimes one ward or one neighborhood says, I don't get the enjoyment of that, so why should I have to pay for it? So let's get down to dollars and cents. $2.5 million conservatively, based on what our Dave Fredette had explained to us, would be about $650,000 is what it will cost the city, beyond the $2.5 million. So we're looking at like about $3.1, $3.2 million is what we're looking at in total. So let's put that all on the table. It's more than the 2.5. But the bottom line is that this is something that can never be gotten back. And while I do respect that you may have some people within your ward that have never gone there, there are some people in Ward 3 that have never been able to make it because they don't drive, so they don't make it to Mine Falls. But they do use Greeley. So you say, okay, so it's only Ward 3, but it's not only Ward 3. This is very historic, specialized land. To remove the trees, to create blasting is going to have a negative effect. I am not an arborist, I am not this, but my common sense tells me exactly what will happen. We will lose a good portion of Greeley Park in there. And the bottom line is if we can purchase this land, if we can parcel it together, I refer to the word as annex, and I think it was Attorney Bolton says, I don't know what you talk about annex. So let me put it to you this way. Let's attach it. Let's attach it to Greeley Park. Let's kind of complete that circle. Take the Columbia Ave area, take the part of Greeley that goes around, add this right into it. As you heard when I read, Greeley Park at one point was 160 plus acres. We've lost land because of erosion. We've lost land because of encroachment. People that are moving, do it slowly, kind of move in and move in and move in. Sadly, we need to stop this. We need to stop the shrinkage of Greeley Park, and we need to look at it as a city. I don't think, in my opinion, $3.2 million over 20 years is a lot to ask for saving this park. We vote all the time in this body here, not just because our wards tell us to do it. The Performing Arts Center is a perfect example of it. We voted because it was the right thing to do. Some people said, nope, we're gonna vote for it because my ward told me not to, so therefore I didn't. We all did what we felt was the right thing to do for the greater good and for the whole. And this is what I'm asking. I'm asking people to look at the whole, look at the benefit of it. This is not in my backyard. I have never once taken it that way. I brought up some of those issues because those are real issues. You will be affecting the property values of those homes, and then what happens? Then what happens to the city? People want to say you're going to lose $650,000, but that was based on 43 homes. Truthfully, I don't think 43 homes are going to go in there. Maybe 30 homes will go in there if it gets developed. There is an in and out issue. Unless they purchase the property next to it, they could have a bigger one. This is literally at the corner of Wellington and Bartlett. You're affecting both areas. Anybody who sits there at 4 o'clock on a weekday, you're gonna see all those cars back up going to the school where parents are picking up their children. It used to be in the morning, people were dropping off the children. The residents that live there deal with that anyways. To add more traffic to it. I don't think it'll be as significant traffic as many people have been saying that it will be, but it's still adding additional traffic. Traffic that those residents can't deal with. Already the residents are dealing with people from that school that are blocking their driveways and so on. And trust me, I talk to them, they're very nice, but parents don't listen. They're anxious, they just got out of work, they want to pick up their children, or they're late for work and they have to drop off their children. They get frustrated, they get aggravated, and the neighbors have to live with it. School was there, school's been there for a long time. These properties aren't, they're not there now. This is the last chance we have to save that land, the last chance we have to save that forestry, so. Again, it's in your hands, and hopefully it makes it to the board. So I'll leave it at that, thank you.
Thank you. Anything for Alderman Schmidt?
Having a hard time equating this with the Performing Arts Center.
Okay.
The Performing Arts Center, the design for me in Ward 1, I go to shows maybe once a year. That's not why I voted for that. I voted for that because it would essentially lower taxes for people. It would actually do that. That income and what that brings around it will lower taxes for the residents. I don't see Greeley Park addition doing that for us. And I can certainly understand why Ward 1 would say, this is really an expensive thing for us that we will never see anything from. It's going to remain wooded. It will only be used by, 30 people over, a month? People don't go through the woods. They are down by the road where there's picnic tables, and I know the neighborhood uses it, but I don't think a lot of people in the rest of the city use it. And one more thing. There have been plots of land that we have lost to developers. Really great pieces of property. Recently there was one, I believe it's in Ward 9. It had been a camp of some kind. Beautiful piece of property. I mean, it had everything. It was in the middle of an area where they could really use it. And I had people who called me and said, can't you save this? Looking into it, there weren't enough people who said, can't you save this? Even people in the neighborhood didn't speak up. We could have used the $3 million for that. It would have really enhanced Ward 9. It would have saved a piece of property that was historic. It had been a camp for a century. And it seems wrong to pick one over the other just because maybe a few more people are vocal about it. And picking and choosing like this, it just seems wrong to me.
Alderman Clee.
Thank you, Mr. Chair. And I respect everything that you said there. I also say that I don't think we're picking and choosing. The fact that we lost that opportunity to purchase that land or to save that land or do anything like that, that is no reason to punish another property that comes up. But I do respect and I do understand exactly what you're saying. I think it is a shame that we lost that property. I think it is a shame that we did not take more into consideration. I don't think that is the same thing as Greeley Park. Greeley Park is quite historical. The entire area within that area is quite historic. The historic district goes almost up to that area. And the reason it doesn't go up to that area is because at one point, those homes were all part of one property. They were subdivided in 1955, I believe, was the Barker home was built. 1958, the one next to it. In 1999, the one next to that. This at one point was very big property, and it was slowly picked away. And actually was, I believe it was the Barker family or descendants of the Barker family at one point that had owned those properties and slowly started cutting them off. The problem that I see here is that this is just a slippery slope. Once this gets developed, what stops the next two homes next to it from getting developed? To putting in more homes, to putting in right up against Greeley Park, is all those homes literally go right up against Greeley Park. When you say only 30 people and they're all from that area, I disagree with you on that. As I said, I see, and it's not just the picnic area, I see families from Massachusetts and license plates from Massachusetts every single Sunday, oftentimes on Saturday. Yes, they're picnicking, and yes, they're hiking through. We walk through there, and I'm a resident of Ward 3. This is not quite in my backyard. I'm a little bit over a few streets. We walk through there all the time. We meet people all over, not just from Ward 3, not just my constituents. I've talked to people from Ward 1. I've talked to people from Ward 7. I've talked to all kinds of people who enjoy it. And if you do walk the current trails that are there, you will see the barbed wire fence. You will be able to see the Barker home. All that woods from that fence, where you can already see the Barker home, already from that fence, you will now see homes. You will have cars that will be putting exhaust into the park because they will abut the park. They will hurt the park. I'm sorry. We did buy property that did abut Mine Falls because we saved it, because we did not want to hurt Mine Falls. I say save Greeley Park. This is not in Greeley Park, so anybody who says differently, they're wrong. This is in the armpit of Greeley Park. This literally abuts it on like 2.5 sides. Anything that's done to it from the blasting will affect the wildlife there. If there are vernal pools there, there is a small wetland area. If there are vernal pools there, it's going to affect them. There are bear in there. There are fox in there. There are, the normal critters that we see all the time, the squirrels, the chipmunks, the birds, et cetera, and so on. But we see coyote in there. This will go away. This is like the west side is like this tiny little beautiful park with different types of, be it small, different types of paths for walking, for biking. I see children playing in there. I see all types of things on a regular basis, and I am there a lot. But the idea that I could walk through down that path and all I would see is homes will take away the significance and the beauty of this thing that we call a gem, and it is a gem. The other side of Greeley Park has been developed. They put in a soccer field and a pickleball court and horseshoes and baseball fields and a music venue and so on. There aren't trees there. The trees that are there are all at the other end of the park, and there are no paths through there. It is so thick with brush. But there are paths on the other side, and it's beautiful. I just, the fact that Ward 9 lost their park, and as Alderman Clemens talked about an area behind him, every time we lose any kind of green space, it breaks my heart. This is going to be a loss of beautiful green space that will have a ripple effect. And it doesn't always happen that day. It happens years afterwards. And by that point, by the time we realize the mistake that we made, we cannot undo it. So I really beseech everybody to think about this and to think about the importance of it. It will cost the city $650,000 above the asking price, or I shouldn't say the asking price, over the 2.5 million that I'm asking for us to bond. I think it's important. I think it's important to show to that family that we are serious and that we want to save our park. And that's really what it comes down to. It's saving our park. So while I respect you, I respect everybody in Ward 1 that you have spoken to and so on, it's a crying shame if we let it go. And I think I've said enough. Thank you.
Alderman Lopez, Alderman Clemmons, and then Alderman Lopez.
Thank you, Mr. Chairman. I just wanted to state also that, you know, I mentioned investments in the future, and I often do that because I believe that the city has to make investments. Most investments that the city makes are not going to have a positive return. That's the nature of a city. There are, on occasion, some investments that we make that will have a positive return, and one of those, and I agree with Alderman Schmidt, was the Performing Arts Center, and that's because it's an active, ongoing event center that will attract people to the city center and will, you know, produce economic activity and things like that. You know, for a long time to come after it's built. But the most things that we do don't do that. Most investments that we make are ones where we have to continually put money into you know, upkeeping them. Parks are one of those things. Green spaces tend to be one of those things, although in some cases green spaces are, you know, we have volunteer groups like in Mines Falls that go out and they maintain the trails and do cleanups and things like that. So, you know, there are ways to mitigate these costs. Will there be potentially lost tax revenue? Yes, there will be potentially lost tax revenue. There might be unforeseen revenue, I guess, that doesn't get developed. But, you know, these things have to be weighed out in their totality, and they have to be looked at in a greater aspect of what do we want to see for the future of the city. And while I lament as well the loss of the green space, which was Camp Doucette, I believe, down in Ward 9, we can't dwell on the past. We have to move forward and look towards the future. We have an opportunity here. It's in our lap. I think we should move forward with this. It's got a favorable recommendation from the planning board. And, you know, like I said, this starts the conversation.
Thank you, Alderman Clemmons. Alderman Lopez.
Yeah, well, as we're discussing the Performing Arts Center, and as the person who accidentally introduced that into this, it's my understanding that it itself will not lower taxes. Its function as an economic anchor will bring in revenue that will increase the overall value of the properties around it. That's a benefit to the city. A lot of that benefit, specifically in terms of property value, is tied up in a TIF, so it's going to serve that neighborhood very well and those regional businesses, and allows us the opportunity to add secondary amenities. I think Greeley Park, as has already been mentioned, being on TripAdvisor, is a huge amenity for Nashua and a huge economic anchor where people come to Greeley Park and, you know, if they're going for a hike for the day, they're going for a picnic, maybe they stop at the supermarket to shop for it, maybe they go have a drink after whatever they were doing in Greeley Park. I know it's a huge economic anchor for half of the nonprofits in the city because they're all doing 5Ks through it. So it's a well-used space, and having that kind of green space does have value. Strictly speaking, trying to render it down to just its tax value, again, I think is a disservice to the taxpayers who actually sit right in that area and understand its value. They deserve a voice too. So again, I appreciate the advocacy and the lobbying being done by a very responsible alderman who saw the needs and saw the values and is championing that cause, because without her, we would be missing all of this. and we would be lamenting the loss of that property. Finally, I would just want to point out that the petition that precipitated the Performing Arts Center landing on the ballot, and actually I think Alderman Clemens essentially did that, but the petitions in support of the Performing Arts Center aren't as big as the change.org one. There is a lot of public support for this, not just Greeley Park. I think we should bear that in mind too.
Thank you, Alderman Lopez. So the motion is for final passage of R 21-203. It'll have to be done by roll call. Just for the record, I will be abstaining from this vote due to a professional conflict. So although I'll call the roll, I'm going to abstain. So Alderman Schmidt.
I will vote no on this.
Alderman Lopez.
Yes.
Alderman Clemens.
Yes.
And Alderman Tenza abstains by a vote of 2-1 to 1. R 21-203 passes.
Is recommended for.
It's recommended for final passage, yes, to the full board. Thank you. Next on the agenda is new business ordinances, O 21-073, amending the inclusionary zoning supplemental use regulations. Alderman Lopez, would you like to make a motion for final passage?
I would like to make a motion for final passage.
Okay, by roll call, correct?
I suppose, by roll call.
We've heard about this a number of times. We heard about it earlier tonight. Is there anyone on the committee who has additional questions for Mr. Sullivan or Mr. Cummings?
Mr. Chairman?
Yes, Alderman Clemens.
Thank you. Yeah, so I did have one question. So some folks in the public had a question about why the income level, I believe, was at 80% instead of 60%. So I don't know if you could go over that and maybe also what we might be able to do to get that threshold down a little bit in the future, even if it's in separate legislation.
Be happy to address that. Matt Sullivan, Planning Department Manager. Yes, Alderman Clemens, there are a few factors that sort of weigh on the ordinance as it's drafted and before you this evening. First of which is really the work that was done as part of the housing study back in 2020, which identified the particular need, not only in 1 and 2 bedroom units, but also in what we've referred to sort of colloquially as the missing middle housing. And that really is the 80% to 100% of area median income need. We did review other income needs within that study, but those were identified as the highest priority need. And so when we went into the exercise of doing a feasibility analysis, we focused our revenue neutral element on that income level. And so we did not specifically model for the 60% income levels. I've been fortunate to have a lot of conversations with some of the folks that have spoken this evening. I think we want this ordinance to be an active one, in that we come back in a year or 2 years and do sort of an audit of how we've progressed, do some data analysis of how many units have actually been created, and potentially analyze at that time whether or not there is a need to add a 60% component in addition to those 80 and 100% elements that are included within the ordinance today. So we certainly don't want to discount the fact that there is a need at those income levels and below, as certainly one member of the public spoke to. But we have not modeled that in detail, and we believe that what we've put forward as a revenue neutral mandatory IZ policy is best accounted for through that 80 and 100% AMI as presented. Hopefully that answers your question.
Yes, it does, and so I appreciate that, and I appreciate the fact too that you know, your department and the city staff is looking at this as a living document, because too often in the past we've had you know, the answer was, well, it's the zone, that's just the zoning laws, and you know, and I never understood, and I understand that they're a pain and that, you know, you want to have consistency and things like that when it comes to zoning, and there are things that you don't want to touch that often. But I think when it comes to adjusting to the needs of our population in regards to their income, I think that's something that I'm glad that you're willing to look at And hopefully, in the future, you know, a year from now, maybe or so, we can look at what we could do at a different threshold, maybe add it, rather than taking away or just lowering it to 60, maybe we can add a component to this. So I look forward to working with you on that.
Great.
So thank you.
Other questions by members of the committee? I have one question. So it was brought up before, just tracking. Is this something that will be tracked, the number of
Sure.
affordable units that come online as a result of this, and where will it be tracked?
Yeah, great question. So this effort that we're undertaking this evening to actually install or repeal and replace the existing inclusionary zoning is really just part one of two of our efforts. The second part is actually working with the planning board to actually implement policies and standards that govern how we actually manage these within development projects that are submitted to the city. What's included therein is how we're going to monitor and report those units back to not only the Board of Aldermen to track how we're doing, but also to the Community Development Department, who's sort of monitoring this program overall. So our intent at this time is to work with the Planning Board through the months of January, March or April on working those, developing those policies and standards. As part of that, we will include specific monitoring guidelines as far as how we report back on how we're doing. And I fully expect that based on the aldermanic involvement in the housing work that's been done, that will include at least an annual report to this group. So I hope that answers the question, but we certainly will be reporting back on how we're progressing, particularly with this being such sort of an innovative policy within the state of New Hampshire. And again, recognizing that we may have a need to tweak it as we actually work with developers to implement it.
Thank you. So if I just have two other comments to make in support of it. You know, I think it was impressive that you've had several public meetings on this, come to this committee, come to the board. It's impressive that the developers, you know, have not voiced any significant opposition to this. So it must be a policy that you know that you folks worked with them on this to make sure that it was a good balance. So I appreciate that. I also just wanted to say a thank you to the folks who have been, you know, consistently coming here. You know, Reverend Posada is still online, Rabbi Spirit Savet still online, and Mr. Keating. You know, I think they will also kind of keep us honest and hold us accountable going forward. I'm sure they'll be interested in you know, whatever opportunities there are to kind of fill in that gap for less than 80% of the AMI. They'll be thinking of creative ways for us to do that. So thank you for bringing this to us.
Thank you.
Any further questions or comments? All right, seeing none, I will call the roll. Alderman Schmidt?
Yes.
Alderman Lopez?
Yes.
Alderman Clemmons?
Yes.
And Alderman Tenza votes yes. That's 4 yeas and 0 nays. The motion carries. All right, there's nothing tabled in committee. General discussion by members of the committee? Seeing none. Public comment?
If I may, Mr. Chair. Tim Cummings, Director of Economic Development. I just wanted to put a plug out there that this is going to come up on December 28th for final passage. And I want to just make sure that this body knows that that's going to be the last meeting before session expires. It's really imperative that we have quorum for that meeting so we can move this legislation on. And so I just hope that everyone is aware and cognizant of that detail. It's something that I've been internally ruminating on, and I just wanted to make sure folks were aware of that observation. Thank you.
Thank you. I'm sure there will be a head count done before that meeting. Any other public comment?
Lori Ortolano.
Go ahead, Ms. Ortolano.
Lori Ortolano, 41 Berkeley Street. I just wanted to share a little information from the mask mandate meeting that you had. You know, I think one of the problems with how you conduct your business is that you're only willing to take your information from one source. And even our Board of Health consists of healthcare providers and doctors that only look at medicine from one perspective. You could have doctors up there that would share a different opinion. You could have a nurse on that board that would share a different opinion. And it's interesting because there seemed to be 4 or 5 people at the beginning of the meeting that were not keen on that mandate. And by the end, having listened to your quote experts, they had all changed their mind. But they didn't allow the nurses that were, you know, in the crowd or on Zoom or any of the other people to share any perspective at all. And it's been a while since people have been able to have a voice on this. It's 2 or 3 weeks since the Board of Health meeting allowed community input. Then they shut it down, and then we come out here to an emergency hearing and it's shut down. And I received a letter today from a friend written by the CEO of Southern, and he wrote, as we approach the end of 2021, I wish to give my most heartfelt thanks to all and each of you for all your hard work and dedication to our organization, blah, blah. He says, we're anticipating COVID numbers are peaking now and will soon begin to decrease. We're also pleased to announce that we are having success in retention and recruitment of staff. It was a priority when I began at the end of September, and we are now beginning to see positive results. And this concept that, you know, this is going to blow up again isn't reflected in this letter at all. They're not seeing it. And when I told you that I looked at the numbers, December 3rd, it was 433 hospitalizations. It went up to 462 on December 8th. And right now, as of December 21st, it's 437. And we do seem to be riding a wave over it. And I really would encourage everyone not to go downtown. Don't go to restaurants, bars, clubs, and casinos. We shouldn't even be going into them, and they should be closed. If what the Board of Health is telling us, that the death of one child is significant, and you know, another hospitalization is a problem, then close those places where there's a lot of close contact. And instead of having the doctor sit at the table and say, well, it's their choice if they want to go and put themselves at that risk, I don't know how you can say that when in the second breath you're saying it's overtaxing the hospitals and they can't handle it. You know, I'm a proponent of
30
choice.
seconds.
Like I said, I've been a proponent of the Board of Health, but tonight was, I can't support that organization anymore. I think they're too one-sided. They weren't objective. I was very disappointed in Stephanie Wolf and the pediatrician for sensationalizing the death of a child. He had no data on that. And, you know, we know nothing about that to make a determination. So, and I think the one member who stayed true to their position. Have a good night, have a good holiday.
Thank you. Mr. Como.
Yes, thank you. Alex Como for Lewis Street. I don't want to rehash everything that I said earlier, you know, regarding the Bartlett Avenue property. I would just like to add to that. You know, I had conversations with a lot of people during the election season about issues that were important to them in Ward 6. And a number of those were a couple of really busy streets that we have that don't have sidewalks. And I had a nice conversation also with the Division of Public Works about the sidewalk project. And we had, you know, a conversation about how there's a lot of things that we'd really like to do that aren't possible because we don't have the money. So it's really disappointing to hear that kids that walk to Fairgrounds Middle School and Fairgrounds Elementary School on Lund Road don't have a sidewalk to walk to school on because we don't have the money. But we can find $2.5 million to buy an unused piece of wooded area because some people are afraid that it's going to affect their view. So it's very upsetting that when it's something that, you know, is at the end of somebody's street, we can find $2.5 million to do it. But when it's kids that have to walk in the street after a snowstorm to get to school, we don't have the funding to do that. So that's all. Thank you.
Thank you. Anyone further? Public comment. Okay, I'm not seeing anyone online. No one else in the chamber. Remarks by the Alderman? Alderman Lopez.
I'd like to thank everybody who showed up for the vigil tonight, the longest night vigil, to recognize people that we've lost over the past year that have been unsheltered or been staying outside. I think tonight's inclusionary zoning board is, at least their favorable recommendation and the ability to advance it is something tangible, which means a lot to providers who have been working with people for years, trying to help them navigate the issues that are systemic in accessing housing and accessing employment, transportation, that generally a lot of people will not consider important for matters of principle, like how it affects their taxes or whether these people, quotation marks, have somehow incurred the wrath of a higher power and deserve what they're getting. The excuses have varied year after year after year, and the indifference to people who are suffering right in front of us hasn't really waned. So it was encouraging to see the turnout today. Everybody was socially distanced, everybody was wearing masks, and there was a lot of commitment, I think, to trying to uphold principles of thinking for others and trying to find ways that nonprofits and community members and the city can work together to address this. Because as earlier it was referred to the city's looking for rebranding. And I think we should dare to rebrand. I think we could be a city of kindness. I think we could be a city that looks at its people as resources instead of obstacles to whatever development of amenity or whatever is in their way. So I was encouraged by tonight's participation, and I appreciate the support from the public. I even had some members of the public donate some hand warmers, which are far short of being enough for somebody who's sleeping outside, but they'll be warmer with them than without them. So I appreciate that.
Thank you. If Alderman Clemens and Alderman Schmidt don't mind, Ms. Ferreira did have her hand up and I just missed her during the public comment, so I will go back to her if she would like to make a comment. Ms. Ferreira?
Sorry.
Okay.
Can you hear me now?
We can, yes.
Okay. I just want to thank everyone that voted in support of the R-21-203. I'm just so grateful, more than you know. And I one of the things that I didn't get to say in my 3 minutes, because I'm a very long-winded, detailed person, and I apologize, is through reading through the master plan, it talked about climate change. We didn't even talk about what that's going to do when the trees are cut down. And one of the goals in the master plan is to commit to climate change. Also, we've noted that we know there's a lot of ledge on that property. And there's a 20% increase, according to the master plan, of significant rainfall in Nashua. And they don't expect that to go down. So my concern has always been, if you have a developer go in and cut down those trees and it's on ledge, then you're going to have a flooding problem. And both of those streets run downhill from that property, and there's a significant slope on that property as well. So I'm just asking everyone who is involved in the alderman vote for the bond to keep that into consideration. This is not a Ward 3, again, issue. This is so much more than just in my backyard. And I look forward to seeing this property become annexed and that armpit being brought in, and then working with the Boy Scouts and forestry groups to create more biking trails and walking trails. I'm a huge animal advocate, and I can tell you, I have hundreds of friends in Nashua, literally, that walk through the current trails in Greeley right now with their animals. And that's going to bring in revenue if we market it as a animal haven for walking trails. So thank you again. I appreciate all of you. You've had a long night. It's, again, not an easy job, and I don't want your job, but I appreciate you. Thank you so much.
Thank you. Alderman Schmidt.
Thank you, Mr. Chairman. I'd like to take a moment to thank the people who wrote to us, the people who took their time to write reasoned and interesting letters about the mask mandate. When science is used, when discussions about issues that you have with masks. All of that matters to us. What mattered just a bit more was what we're watching as far as the numbers. I said 19 people died yesterday. Someone has corrected me, that was 25. This is not the time to believe that your freedom to go maskless beats everybody else's freedom to be safe. Thank you very much for writing. It was really important to hear from you. And I'm very sorry that I could not vote for the purchase of the property at the park. If I had my way, I'd buy up all the land that we could and save it for the future. I don't have it my way, and I'm not sure the city has the funds to do this. Thank you.
Thank you, Alderman Schmidt. Alderman Clements.
Thank you, Mr. Chairman. I too want to thank everybody that reached out over the past week or so regarding the mask mandate. I responded to I believe I responded to every single email. So I just wanted to make sure that of the hundreds of emails we got, I responded to all of them, and I did try to do that. The other thing is, you know, I agree with Alderman-elect Como in a way. I wish we could actually do the sidewalks and Greeley Park, because despite the fact that I voted against the mask mandate, I am still sort of a liberal Democrat, and I don't mind spending people's tax money. So if we could find a way to do the the sidewalks and Greeley Park, I would be happy to do it. But of course, we don't have an unlimited budget. We're not the federal government. We do have to live within our means. So I understand that there are choices that have to be made, but you know, we get pretty creative here in Nashua, and I think, and I'm hoping that when you come on board, Alderman Como, I hope you see that that there are, you know, it doesn't always have to be one or the other, and that there are ways to work together to find solutions. So I look forward to working with you on that. Ward 6 is my home as well, so hopefully we can work together. And then lastly, I just wanted to, for all the people who celebrate, I wanted to wish everyone a Merry Christmas, and we will see you all next week before New Year's.
Thank you very much. Okay, well, I think we've taken care of all the business we need to take care of tonight. So Alderman Schmidt, would you like to make a motion to adjourn by roll call?
Yes, I move to adjourn.
All right, the motion is to adjourn. Alderman Schmidt.
Yes.
Alderman Lopez.
Yes.
Alderman Clements.
Yes.
Alderman Tenza, yes. It's 4 yeas and 0 nays. The motion passes. The meeting is closed at 10:54 p.m.
Oh, dear.